It might also interest us to know we have other commissioners who are joining this event virtually. We have also in the room implementing partners, international partners, directors from ministries, departments, and agencies of government of the Federal Republic of Nigeria. But I formally welcome us all to this event, honorable distinguished colleagues and leaders in the room. It is my pleasure to receive the Director General, Nigeria Center for Disease Control. I'm sure some of us may still not recognize our DG very well, being relatively new, but not too new any longer. It's been some months on the saddle. It's a pleasure to receive to the microphone the 3 times Commissioner for Head of Lagos State, in person of Dr. Jide Idris. A better warm round of applause for my DJ, please.
Minister for Health and Social Welfare, Professor of Party, representatives of the federal ministries of Agric, Food and Safety, and Environment, my former colleagues, the commissioners for health here present, both physically and virtually, distinguished partners, other stakeholders, distinguished guests, esteemed colleagues, ladies and gentlemen. I want to, on behalf of the Nigeria's Pandemic Fund Committee and the NCDC, it's crucial in navigating the challenges that will be associated with any future pandemic. As we all know, it is work in progress for the country to be where we should be when it comes to pandemic prevention, preparedness, and response. Learning from the last pandemic, that's COVID-19, emphasis on prevention, disease surveillance, and preparedness, and response capabilities. Our predecessors started addressing this, but this current government has not only prioritized health, but under the leadership of our Honorable Coordinating Minister, has gone further to make health security a crucial pillar of his 4-point agenda under the Nigeria Health Sector Renewal Investment Program, a priority. Today, we are gathered here with a shared commitment to foster transparency, collaboration, strategize, and ensure Nigeria's application for the pandemic fund is effectively used in addressing our national needs. The various diverse expertise and perspectives present here are invaluable as we navigate this co-creative process, using various guidelines and considerations such as the One Health approach, gender sensitivity, equity issues, climate and health, etc. This dialogue serves as a platform for a meaningful exchange to refine strategies, ensure accountability and optimization in our application, so that our national priorities will be clearly defined to develop a comprehensive and compelling grant application with a unified national voice, that is one country proposal. Let me say that this grant cannot solve all our problems. It is clear to understand that. But we need to prioritize because there are other opportunities coming. I sincerely apologize for the late invitation to all our guests and participants. It was due to unforeseen constraints in our timelines and schedule. We understand the importance of adequate notice and deeply regret any inconveniences this may have cost you. It should be noted that your presence here today will greatly enrich the event, and we value your participation extremely, for those of us online too. Finally, I extend my heartfelt gratitude to you all for your dedication to this vital cause. Let us harness the power of collaboration and innovation as we work towards a more effective, resilient, and prepared public health emergency system for Nigeria. We all look forward to an interesting and insightful dialogue, and more importantly, success in our application process. Thank you very much.
Thank you very much, DG NCDC, Dr. Jide Idris. We move on to our opening remarks, and I would like to warmly welcome with the single honor the Coordinating Minister of Health and Social Welfare, Professor Ali Pate. Please put your hands together for him as well.
The Director General of the NCDC, representatives of the ministries of Agriculture, Environment, and other ministries that are here, my colleagues, the Honorable Commissioners of Health from the states, our development partners, distinguished ladies and gentlemen, good morning to you. I was just telling the DG that he's already given the opening remarks. This is a dialogue. I would say I just agreed with whatever he said, and let's just get on with it. But he asked me to say a few words. Just to re-emphasize the importance of our efforts to improve health security in Nigeria within the context of the Africa region, within the context of global health security. We know that it's not a matter of if, but when. Because reimagine infectious diseases are encroaching in our societies, globally, in the continent, but also here in Nigeria. We saw with the pandemic, but even before the pandemic, we should have anticipated that. But the pandemic has become a wake-up call for us. And while at the global level, there are conversations around a new pandemic treaty, we have to also do our work domestically. And we hope that soon there will be an agreed pandemic treaty to strengthen global health security in the lines of responding to the lessons of COVID-19. But here in Nigeria, we know that every day we have small outbreaks. It is outbreaks that grow into epidemics and into a pandemic. So how do we strengthen our systems here so that we prevent, as the DG said, we prepare, we have good surveillance system, and be able to respond promptly when an outbreak occurs of pandemic potential, or when a pandemic occurs and then it's having implication for our country. And in the context of the President's Health Sector Renewal Investment Initiative, we know that there's a key pillar on health security, which is to strengthen our ability to detect spillover events if they happen here, to prepare to have good surveillance systems, but also to be ready to promptly respond based on the lessons that we have learned. And the Pandemic Fund is one instrument, it's not the only instrument. And so the dialogue here is very important in terms of our ability to bring together a coherent proposal from Nigeria to the Pandemic Fund so that we can get the resources that will enable us in a one health way, in a cross-sectoral way, to deal with whatever it is that we may have to do to prepare to actually safeguard our own health in this country. A few months ago, for those that are in the One Health Steering Committee, we did get information from a study somewhere in this country where fruit bats were captured from an urban center and antibodies to pathogens of pandemic potential were found. There is no evidence that, in fact, they spill over to human, but it means that those pathogens are lurking somehow in our environment. And it requires Ministry of Agriculture, Ministry of Environment, ourselves working together. And so in the context of the Pandemic Fund, we thought that the application that Nigeria put forth should truly reflect that intersectorality that is necessary to safeguard our nation's health security, and that strengthen national systems, use the NCDC, strengthen them, and urge our development partners to back us up, because in the long run, the sustainability of whatever we have will depend on the national systems that we build. And I am very glad that the Pandemic Fund team at the World Bank also agreed with us a few weeks ago to use this mechanism so that we use national systems with the support of our excellent technical and development partners in that regard. So I really look forward to the dialogue, the outcome of it, and having a robust proposal that we can take forward to the Pandemic Fund Committee and get it approved. And from the point of view of the federal government, I think through the HOPE investment that is being developed, we want to be sure that the World Bank certainly includes public health in the actions that are necessary between the federal government as well as states, so that we move together in tandem. And the pandemic fund is embedded within that, so that we have one coherent approach consistent with the sector-wide approach that we have in the sector, so that there is no fragmentation, but you use one government system, one national system, one direction, one way of reporting, leveraging all available resources in an inclusive manner with the NCDC, with the ministry, with other ministries, all in the dialogue. Let's have one conversation. So thank you very much, and look forward to the outcome of this conversation. Thank you.
Absolutely. The need to strengthen our ability to promptly respond to public health emergency definitely cannot be overemphasized. It's also important to note from the words of the Honorable Coordinating Minister of Health and Social Welfare that safeguarding the health of our nation, the health security of our nation, is a collective responsibility going through this sector-wide approach. And in this, we need everyone's participation. Honorable Minister, sir, it's our pleasure to always have you, and always a great delight listening to you. A better round of applause for the Honorable Coordinating Minister, please. Moving on in this engagement, I would like to receive a few goodwill messages. It might also interest us to know that we try to check with the coming in of the other representative or the ministers of the other sectors, Ministry of Agriculture and Ministry of Environment. As soon as we have them in the room, we'll be glad to bring them up for their remarks. But in the interim, we need to move on quickly to receive the goodwill messages from our developing partners. Starting, we'd like to receive to the microphone the representative of World Bank here in our midst. It's our pleasure to make welcome to the microphone, Dr. Mike Olubile. Dr. Mike, please. A round of applause for him. So that we get prepared. After Dr. Mike, we'll be receiving the remarks from WHO, please. Thank you, Dr. Mike.
Honorable Minister, other distinguished member present, please let me invite Dr. Chijoke Okoro to speak for the World Bank.
Okay, so yeah, thanks, colleagues, and the Honorable Coordinating Minister for Health and Social Welfare, the DG NCDC, and colleagues, commissioners for health present. Just greetings from the World Bank and everyone. This is one family. We've been on this for the last couple of weeks, and it's good to see that we're at the point where we have a chance to do the national dialogue. Like the coordinating minister said, one of the key lessons from COVID is that no one is safe until everyone is safe. Working together is not even an option at this point. So this national dialogue presents that opportunity for us to kind of articulate collectively what to be the priorities that will be included as part of the package for the pandemic fund. The pandemic fund in itself is not the silver bullet that solves every single problem. And so I think that it's important for us to understand that as we think of the pandemic fund application itself, it's also an opportunity to think about the fuller program for health security in the country. And I hope that today and the few days before we click submit in the portal, we'll have a chance to make this sharper so that we are more successful this time. On behalf of everyone on our team, we just want to say welcome and thanks to everyone.
Apologies for that, Dr. Chijoke. I think the name given to us earlier was for Dr. Mike. I haven't been a regular face around anyway. All right, thank you very much for representative World Bank for all you do. And definitely, we agree, no one is safe until everyone is. We are all in this together. All right, moving on in that spirit, still staying with the world. Would like to receive to the microphone the representative of the World Health Organization. Can I confirm that we have Dr. Mayor Kamura and she's the one speaking? I want to believe she's the one. Okay, we have the WR is there. You see why it's important to cross-check. A better round of applause for WR. Thank you very much.
Thank you. Just to confirm, my name is Dr. Walter Kazadi Mulombo and Dr. Mie. Honorable Coordinating Minister of Health and Social Welfare, distinguished guests and my colleagues, technical partners. It's a pleasure for me to join you here and join the Coordinating Minister of Health and Social Welfare and DG NCDC as a secretariat to One Health ministerial platform for One Health, which is the drive for health security in Nigeria. And I'm particularly pleased to be part of this national dialogue, and I'd like to start with congratulating you, Honourable Minister, for this initiative. Like you said, this is one mechanism. It's not the only one. But what really matters is to make Nigeria safer, and Africa safer, and the world safer. And for that to happen, Nigeria matters. Honourable Minister, you will recall that when you convened the ministerial roundtable on malaria elimination, Director General had to join virtually. And when he joined, he came out of a meeting of governance bodies, governmental bodies, who were discussing the provision of the next pandemic treaty. Member states are not on the same page. Some are saying what is being proposed as modification to international health regulations is too ambitious. There's too much. There is too much power being given to WHO as a coordinating body. Others are saying what is there, it's not enough. But Dr. Tedros said what matters is what will tell our future generation. And I'm sure they will be proud of us if they see that when eventually the next pandemic hit, what we decided this May would have played a major role. And what we are doing here today is also part of that. And I couldn't agree more with you, Honorable Minister. It's time to strengthen national system. It's time to have Nigeria better prepared. And the pandemic fund is one of those mechanisms to make sure that Nigeria is much better prepared. We have learned a lot from COVID-19 pandemic. The doom that was predicted didn't happen here in Nigeria. We saw at the beginning of the COVID-19 pandemic, WHO promoting what we are calling the Nigerian approach to tackling the pandemic. So there are obviously examples of good practices. Funding is important, and we want to work together to support NCDC to be the driver of this effort. Global health security started somewhere. It has become a global issue. The example of bats that were picked in Nigeria with virus of pandemic potential should be in itself a high opener, a call to action. We have others, like antimicrobial resistance, which is seen as really the next pandemic. Not forgetting that the flu pandemic that we've been preparing for is yet to hit. COVID-19 pandemic was maybe just something for us to be aware that no one will be safe until everyone is safe. So I would like to urge all my fellow colleague partners to work towards the same goal and support NCDC to have a stronger proposal a better one than we had at the first attempt, so that we could at least use that as a mechanism to engage all of us with the swap approach spirit. Thank you again for the opportunity, for having us here. We will continue to play our role alongside the World Bank for the pandemic fund, with WHO, as you know, as a lead partner in terms of leading the technical secretariat. Thank you again for listening, and thank you for joining us as we start this national dialogue. Thank you.
Dr. Walter Kazadi Mulombo, the WHO Nigeria. It's our pleasure to have you. Thank you very much. As we prepare to receive the next goodwill message, I like to, just as I recalled discussing, making contribution during the event the minister referred to earlier on about the issue of bats in Nigeria. I said the publication we had as far back as 2013 was part of the study, Bats and Lissa virus exposure among humans in area that celebrates Bats Festival in Nigeria. Tells us that this is not just a recent happening. And I believe that following this meeting, we're going to definitely advance conversation in this regard moving forward. Bringing a coherent proposal to respond is our goal on this agenda. It's my pleasure now to receive the representative of UNICEF. He has asked that I introduce him this way, that's how the minister calls him. I should introduce him as Dauda Eduardo Celades. A round of applause for him, please.
Thank you. Thank you very much, MC. Honorable Coordinating Minister of Health and Social Welfare, dear DG of NCDC, dear Health Commissioners, WR, let me stand in all protocols. I would like to start the goodwill message where the Honorable Minister, my professor, Mohamed Ali Pate, ended on Friday on the malaria meeting. He talked about 9 shifts that need to happen in Nigeria for malaria. I don't remember the 9, but I remember the first 3 that I think are very relevant for the pandemic preparedness and response proposal and fund. To moving from idealism to pragmatism, to moving from fragmentation to coordination, and as well to, what was the third? Okay, I remember maybe two of them. The third one was to moving from business as usual to business as unusual. And I think that these 3 shifts are very needed on the work that we are doing today and we did over the last few weeks. Because we have the swap coming, so this is a golden opportunity to integrate all this work within the swap, right? To be able to reduce fragmentation and to have a coordinated approach. But as well, it's a golden opportunity to do business as unusual. One of the challenges that we are facing is the multiple of outbreaks that we have. Meningitis in some of the northern states, Yobe, Bauchi, etc. Last year, we had the diphtheria outbreak in Kano, etc. We have as well measles outbreaks in Borno, Adamawa, a lot of them. So, but you know that the best outbreak is the one that is responded as soon as possible and is not in the news because they don't spread, right? So this is where we need to move. And I really think this proposal is a great opportunity for that. I would like to highlight 2 issues that we believe are important and are already there, but I think they need to be very much highlighted. One is the role of community health workers. We need people at community level that they are able to talk on what is happening, to raise the alarm, to inform of the rumors, to be able to respond quickly. And we have this amazing network of CHIPs, CHIUs, VCMs, etc., that now they are going through a redesign. So I think it's a great opportunity to ensure that this proposal ensures that community health workers are an integral part of the response. That will be my appeal for the discussions today, that community health workers are here. The other one as well, we need to think in our health workers. We have a massive issue with health workers. So they need to be protected as well. And I am talking here about IPC, infection prevention and control. We need to ensure that the health workers at facility level, they have the masks, the gloves, the aprons, the goggles, so they are able to manipulate the samples and to really respond. So it's my appeal that during the discussions today, I know that these things are already in the proposal, but we really make them explicit and we ensure that we have all the tools that we need to respond. To end, I was reading this quote of Chinua Achebe over the weekend that said, If you don't like someone else's story, just write your own story. And I think this is what we can do here today. Thank you very much.
The Chief of Health, HIV/AIDS of the UNICEF, representing the organization, Dauda Eduardo Seladis. A round of applause for him again, please. Maybe you want to find out from the Honorable Coordinating Minister why he chose to give him Dauda. All right, so we move on to other goodwill messages. In the interest of our time, we kindly appreciate as we keep to time, just a minute each. I would like to receive to the microphone the representative of Food Agriculture Organization, FAO. Again, I don't want to commit another blunder here. Can I confirm? Okay, now it's still Dr. Zira. A round of applause for him, please, as he speaks for FAO. Thank you, Dr. Zira. You have the floor.
Thank you very much. I bring you greetings from the representative of the FAO to Nigeria and the ECOWAS, Kofi Kwaku. We congratulate the coordinating minister for this very important step in putting together the application for the pandemic fund. And even beyond this process, it's important to see that year in, year out, the multisectoral coordination has been growing. And if we have to achieve what we want to achieve beyond resources, we have to see how we can harness what animal health is doing, what human health is doing, and come together. Recently, there have been reports of HPI in cattle in the US, in feline, and we see that the issue of the flu is coming. It's not far from us. So it's been said that this step is not, the pandemic fund does not solve all our issues. So while we look at this application, it's important that we think outside the box to see what other resources we can leverage on. How can we put our resources together from the different sectors to achieve the common goal, which is health security. I hope that this dialogue will open us up to more and more of those opportunities to see where are the loopholes and what we need to do. So I congratulate us all and I welcome us to this activity. Thank you very much.
We kind of appreciate that you keep the all warm as we continue to give some applause to the speakers as they move on. For my section, I'd like to conclude this first part of the goodwill message. You can understand we go from the what, then we go to country-specific support, developing partners. But before that, we like to receive the senior country manager for Gavi here in our midst. Please, let's make welcome with a round of applause, Jessica Crawford. A round of applause for her, please.
Good morning, Honorable Coordinating Minister of Health and Social Welfare. Please allow me to stand on existing protocols. First, I'd really like to say I'm delighted to be here. The Pandemic Fund is a new and a very exciting opportunity for us as Gavi, and we're really thrilled to be engaged. As we look ahead into our next strategic period, our Gavi 6.0 period, we're really enthusiastic about our role in supporting countries in health security and pandemic preparedness and response. As you'll be aware, we are one of the 13 implementing entities for the fund, and as such, it means that our grant funding, as well as the Pandemic Fund grant funding, can be complemented and can support the country's priorities. So today, I'm really looking forward to understanding the priorities of Nigeria and how Gavi can directly support and engage in the fund proposal and development, as well as its support going forward. So thank you for the opportunity, and I look forward to the dialogue and to supporting the application moving forward. Thanks.
A round of applause for her again, please. It's delightful to hear that our global partners are happy to support this process, and you're looking on and moving further in this on our goodwill messages. We'd like to call on the representative of USCDC. I wouldn't want to do the same blunder as my colleague. If I guess it's Dr. Farah, please make welcome Dr. Farah as she comes to the podium.
I hope you guys can see me. Good morning. Please permit me to stand on established protocol. On behalf of the USCDC, I'm delighted to be here at this national dialogue on the pandemic fund. Following the official establishment of the fund's governing board, CDC is aware of the numerous efforts made to catalyze an accelerated action towards meeting its broader goals of strengthening critical pandemic prevention, preparedness and response capabilities in low and middle income countries through investments and technical support at the national, regional, and global levels. CDC is very happy to provide a series of technical assistance to the national government, especially the federal and state ministries of health, their departments and agencies. CDC recognizes the urgent need to continue to invest resources to address the long-term shortage of funding for funding pandemic preparedness plans, and to continue to leverage the rare opportunities to ensure Nigeria's readiness is optimal. We recognize that collective efforts by different institutions will contribute significantly to building more resilient systems. And all stakeholders need to contribute to new innovative financing mechanisms like the Pandemic Fund that are results-driven and promise to revise the trend of underfunding health security initiatives. Our participation throughout and in today's event demonstrates our willingness and commitment to support the successful implementation of the Pandemic Fund mechanism in Nigeria. And this further points to our strategic partnership with Nigeria and the mutual collaboration to support health security and response to disease threats. Let me use this opportunity to thank the leadership of the various institutions who have played a vital role in the process that went in so far. Permit me to also reiterate that CDC remains committed and stands ready to continue our partnership with Nigeria in its response to public health disease threats and adopt strategies that will increase disease prevention, detection, and response. I thank you and look forward to a fruitful national dialogue.
Thank you very much, Dr. Farah. Collaboration, innovation are key to really finding new ideas and new opportunities to leveraging the pandemic fund. I'll quickly check if we have representatives of the UKHSA in the room. We couldn't get an indication. Okay. Please welcome her as she comes to the podium for their goodwill remarks. Please a better round of applause, please.
Good morning, Honorable Minister and Dr. Jide Idris. On behalf of the UK Health Security, I bring goodwill. Dr. Shola Aruna, unavoidably absent. She asked me to represent her, and I want to say I'm delighted to be here representing the UK Health Security. We actually been part of the system from inception, and last year also the writing of the proposal, and we are also here again to provide support that will help to forge forward, especially getting the pandemic fund. So without wasting time, I want just to say we are happy to support the process technically. Thank you.
Thank you for your technical support, UKHSA. I'll call on Dr. Lamorode, Resolve to Save Lives, just to quickly give their goodwill message. A round of applause, please, as they makes it to the podium.
Good morning, Honorable Minister, DG, commissioners, distinguished ladies and gentlemen. Resolve to Save Lives is very proud of its partnership with Nigeria's government agencies, in particular the work being done by Resolve to Save Lives and the NCDC in critical areas such as the 717 initiative, enhanced situational awareness, and epidemic-ready primary health care are all things that can be done to strengthen our health security moving forward. We really appreciate the partnership. We wish Nigeria success in its current application, and we thank all the other partners that have been working very hard to see this day come true. Thank you.
All right, thank you very much, Resolve to Save Life, for all you do and all our developing partners. We need to quickly skip to do this because I'm told that the Honorable Coordinating Minister may have some other engagement to attend to. If we have your permission, Honorable Coordinating Minister of Health and Social Welfare, Professor Hali Pate Siohen, I'd like to recognize here in the room the Honorable Commissioners for Health, who, despite the relatively short notice, were able to still make it to this meeting. And as I do this, I'd like to please kindly appeal that they please make their way to the podium. We have 6 of them here present. We invite all the 6 out, and we kindly request one of them to please speak on behalf of the Commissioner for Health. I'm sure they are trying to do a consultation quickly to see who speaks, but that is fine. So, first on the list I have here, we have Dr. Dolapo Fashawe, Mandate Secretary, Health and Environment, FCT. A round of applause for her, please. Then we have Dr. Tomi Koka, FCT. Dr. Tomi Koka is Honorable Commissioner for Health, Ogun State. Apologies again. A round of applause for Dr. Tomi Koka, please. We have Asabe Balarabe. Aja is the Honorable Commissioner for Health and Sokoto State. A round of applause for her, please. This way, please. Then we have Dr. Mohamed Ghana, Honorable Commissioner for Health, Yobe State. And representing the Honorable Commissioner for Health is the Permanent Secretary of the Ministry of Health, Kaduna State. Ladies and gentlemen, please let's make welcome Dr. Haishatu Abubakar Sadiq. Can I confirm there is a consensus on who to speak? The Vice Chair. The Vice Chair, the floor is yours, sir.
Honorable Coordinating Minister for Health and Social Welfare, DG NCDC, my distinguished colleagues, distinguished personalities.
Apologies, I'm just being informed again that we have the Commissioner for Health Edo State just joined us. And also representing Commissioner, see, this is, apologies, Honorable Minister. I'm not always like this. It's the list I was given. Apologies, so it's not really a deliberate goof. So we have just joining us also, although we have the Honorable Commissioner already here earlier on representing from Ondo State, the Permanent Secretary for Ondo State. Represented Honorable Commissioner, and we also have the Commissioner for Edo State all in the room. Thank you very much. Thank you very much. We actually want all of you to stay so that you can have a group picture with the minister before he leaves. That's the idea, but it's fine. Over to you, sir.
Honorable Coordinating Minister for Health and Social Welfare, DG NCDC, my distinguished colleagues, distinguished personalities, ladies and gentlemen, good morning. On behalf of the Forum of Honorable Commissioners of Health, I wish to express our delight for the opportunity to participate in this very important forum. And of course, being a public dialogue on the pandemic fund. As we all know, the states happen to be the greatest, will happen to be the greatest beneficiaries with regards to this fund. I think all the action actually happens in the states, and more than ever, we as states are committed to see to it that we safeguard the health security of the country. As a forum, we always come together to collaborate with each other, support each other, so that we all move in the same direction, and also to collaborate fully and support fully the aspirations of the Federation. With the coming of the Honorable Minister for Health and the SWAP agenda, this is another area where states will largely benefit, in the sense that we've always yearned for a situation where we'll have, the achievement of outcomes that all of us will work together to achieve. If that when we get this, the states will also gain access to the critical funding that is needed for us to actually put up our, our structures for preventing, detecting, and also responding to pandemics in the country. Already, as spoken earlier, we've already been facing these small outbreaks. But then, of course, to some of us, I think they are also on epidemic scale. Some of these outbreaks are actually, well, to some of us, we see it as even embarrassment, because in 2024, if you still face outbreaks of diphtheria, and meningitis, I think these are things that we should actually have, gone far away from. But then we're still recording them. There are so many needs, and part of it is also to see how we can strengthen the local government and also the ward levels, because again, even at the state levels, going lower down is actually very important. As we've experienced, we had to move emergency operations centers to the local governments and even the ward levels to work together. And of course, the critical role that the community health extension workers, as well as the PSC directors and others, play in responding to these epidemics is actually very critical. So as such, I stand here to assure all the gathering that the Forum of Honorable Commissioners for Health will do our best to see to it that this fund application is a success, and we're ready to collaborate in any way possible. Thank you so much, and we wish all of us fruitful deliberations. Thank you.
Vice Chairman Seth, Forum of Health Commissioners of Health of the Federal Republic of Nigeria, thank you very much for the goodwill message on behalf of the Commissioners for Health. So next is just to kindly now request that we please come forward, as earlier requested. The addition to the list earlier mentioned, we have Dr. Niro Ikuomola, the Permanent Secretary, Ministry of Health, representing the Honorable Commissioner for Health Ondo State. And we also have the Honorable Commissioner for Health Edo State, who has just joined us, Dr. Samuel Hali. May I kindly request that we please come forward? Then the Honorable Coordinating Minister, the DG, please to the podium so that we could have a group photograph with the representative of the Commissioners for Health. Media, photographers, can you help us out now? do this one for now. Okay, so maybe in one sweep we can have the developing partners to join later. The developing partners and the World Bank, USCDC, WHO, FAO, Gavi, RTSL, Hafinet. Please let's join the photograph section once and for all. Thank you. Maybe there's a space at the front. The other side.
Okay. All right. Director Special Duties, NCDC. I'm here with other members of the Secretariat in person of Professor Ehi Igumbo. And can we welcome him, please? And Dr. Mohamed Lamolde. Together, we'll be presenting to you, giving you an update of what has happened in the past 3 months with regards to the pandemic fund proposal writing, and also show you some parts of the proposal that will be required for today's dialogue. So we'll start by telling you a bit about the pandemic fund. You already know this, but just to remind you. Next slide, please. Okay, so the pandemic fund for financing to strengthen pandemic prevention, preparedness, and response capacities at national, regional, global levels, with a focus on low and middle-income countries. And it's a collaborative partnership among donor countries, co-investors, foundations, civil society organizations. The goal is to provide investments to improve pandemic prevention, preparedness, and response capacity at national, regional, and international levels. Next. So this is the second call for proposal. Many people who have spoken today have recalled
that they were part of 2023 proposal, which was the first call for proposal. This is the second call for proposal, and it has an envelope of 500 million USD and prioritizes investments under the same 3 priority areas that were prioritized for the first call. Note, however, that the envelope is 500 million USD, but the amount that we can apply for as a country is 25 million USD. The 3 priority areas are early warning and disease surveillance systems, both at the human and animal health level, laboratory systems, and human resources, public health, and community workforce capacity. This slide is something that came from the Pandemic Fund Secretariat. However, for Nigeria, we will be working with the Ministry of Environment as well. So we're looking at environmental issues as we go along. This is to ensure that we have a holistic view and that we are applying for this with a One Health perspective. Next slide, please. So Nigeria is eligible to apply for a proposal that meets the following criteria. We are proposing one country application, and that's what we're submitting hopefully before the timeline for submission. The priority thematic areas already mentioned: early warning and disease surveillance system, laboratory services, systems strengthening, human resources, and public health community workforce capacity development. Like I said, we will be extending this to the environment sector as well. Our approach is coordinated, collaborative, multi-sectoral, and we're supposed to align financing to country and regional planning processes so that they complement one another. The fund, as the DG of NCDC mentioned, cannot fund everything and cannot solve all our problems. But we're hoping that this, when we submit and get the financing, it would help us have a catalytic effect and ensure that we get co-financing, from implementing entities and other international partners. Also, to get co-investment from within the country, provided that we are not under distress. We're also supposed to be looking at issues of equity, gender equity, and broader health equity issues. Next slide, please. Okay, so the timeline for the submission. Right now, of course, you know the proposal, the call for the application portal was opened in March, and we have a submission deadline of May 17. Today is May 6, so we have about 11 days. We do not want to submit on the 17th of May, so we are proposing to have our submission in 3 days before the time. After the submission, of course, the Secretariat at the Pandemic Fund level would go through these activities that have been highlighted, and they expect that our proposal is submitted for grant finance. Any proposal we submit for grant financing should be targeted for formal approval by the implementing entity procedures as well. Ideally, it is expected that the implementing entity program will also align with the first quarter of year 2025. Next slide. Our own timeline within the country. We are in week 1 of May. We've established the launched the Pandemic Fund Application Coordination Group. We've conducted needs assessment. We've finalized priority areas. We've identified and shortlisted participating MDAs and partners. We recruited a consultant to support us. We also conducted a writing workshop, identified relevant MDAs and IEs of all needed supporting documents. We've produced the first draft, which we'll be presenting to you today. We've collated the necessary documents required. And today we're at the National Dialogue Workshop, the first week of May. By second week of May, we hope that we will be able to submit the Nigeria proposal, all with your support. Next slide, please. So I've mentioned all these achievements, and we are now holding the consultation with stakeholders. We held a pandemic fund writing workshop about 3 weeks ago, and that's the photograph that shows those who were present at that meeting. It was a technical meeting. It was all inclusive and collaborative. During that workshop, we had 4 multi-sectoral working groups that discussed issues around surveillance, laboratory, workforce, and project M&E. We were able to achieve at that meeting a consensus for the project objective. We generated and prioritized activities. We finalized selection of indicators that will help us to measure and track our project. We presented plans for coordination and implementation, and we engaged with the Ministry of Finance on requirements and timelines that we also need to put in place outside of just writing the proposal. Post-workshop, we had drafting sections. We also worked with the M&E team, pulled from the different ministries and parastatals that were at that writing workshop. And subsequently, we engaged with other stakeholders, the academia, the civil society. We engaged with them in the last 1 week to ensure that their input is also taken into consideration. We identified also opportunities for this collaboration for civil society, for the academia and the private sector. As enumerated there, the civil society will help us to strengthen governance for this project and also help us with accountability issues within the system. Also support communication and advocacy for policies, improve our implementation at community level. That has been mentioned, and we hope that both the state level and the community, the civil society will help us get the communities involved and so that they can benefit from the project. The academia will be looking at research agenda, monitoring and evaluation, and integrating of health security training into pre-service curricula and general capacity building. While for the private sector, we are looking at resource mobilization and networking. The implementing entity that has been identified is the World Bank. And NCDC would lead the coordination, but will work with all the relevant to ensure that we are working with a One Health perspective. We will be working with all our technical partners that are here and not here as well. Next slide. So the proposed governance structure, we're leveraging on an existing structure, and we're looking at the One Health coordinating structure. The Health Steering Committee will be adding 1 or 2 other members that are not initially part of that. We'll be asking the permission of the Honorable Minister to do this. The Steering Committee will be chaired by the Honorable Coordinating Minister for Health and co-chaired by the Honorable Ministers for Agric and Environment. The Technical Committee comes next. That will be chaired by the DG of NCDC and co-chaired by the Chief Veterinary Officer of Nigeria at the Ministry of Agric and Director of Pollution Control and Environmental Health. The Secretariat will have a project coordinator as well as have sector coordinators from the 3 different ministries. Of course, we'll still be discussing how this cascades to the states level and the community level. Next slide. So that's just a diagrammatic representation of what I just described. Definitely within the project coordinating unit, we'll be looking at our financial management systems, strengthening that, the procurement systems, the monitoring and evaluation, communications and safeguards for all projects of this kind. We need to be looking at ensuring that environmental and social safeguards policies are in place and that we do not contravene any of those, and to also ensure that our project does not have negative consequences to the environment as well as to the social environment. Thank you. Next slide. So we're here today, this national dialogue, and the objectives are to ensure that we are aware, we understand, and that we need to strengthen partnerships. Promote awareness of pandemic fund and funding mechanism and the catalytic role it can play towards sustainable financing for prevention, preparedness, and response. Also to ensure that we promote understanding of the draft proposal and build consensus on the priorities of Nigeria's single country application for the pandemic fund. Then we hope that our engagements in the past will speak for this project as well, and that we strengthen partnership with society, academia, the private sector on the application with a view to establish collaborations, partnerships for the proposal design and implementation. So the inputs that we get from this dialogue this afternoon will also form part of our work in the next 1 or 2 days. So we hope that it will be as participatory as expected. Next slide, please. So after this dialogue, we will be including the feedback from the national in doing some multi-sectoral costing. So we'll be asking for the different ministries to identify their costing experts so that they can join us in doing this. We will submit for expert review. We also have drafted all the cover letters that are required, but we need to tell you that they are ready for your signature. We want these letters from the Federal Ministry of Health, Federal Ministry of Agri and Food Security, Federal Ministry of Environment, and the IE. Letter of support from partners, and for us to finally proofread the application and submit. Thank you very much. So I'll hand over to Professor Ehe to go deeper into what we have as a draft of the proposal. Thank you.
Good morning. Again, I would really stand on established protocol. In a sense, I will be talking to us to the very gist of our proposal, just seeing that slides can get on screen. As the Honorable Minister of Health did speak, we are somewhat trying to articulate his expressions to us this morning in a proposal. I think he very eloquently captured what we're trying to apply for. And what we will be doing in the next couple of minutes is taking us through highlights of the written document. The document has been collaboratively written. A writing workshop, as already described, has been held, and lots of consultations have gone in. A 96-page document already exists and is in circulation for varied inputs. So what I would do is kind of try to highlight a bit on the context in the document therein, the gaps so identified, the objectives, the scope and priority thematic areas, and our proposed M&E framework. In setting the context, our current proposal makes very clear expression about the solid standing of Nigeria. Speaker after speaker have also kind of eloquently pointed this, that Nigeria matters. Nigeria matters by its sheer human population and what it means for regional health. It's over 220 million people. Nigeria matters by its animal population, and we give estimates around its poultry and other agric indicators. Nigeria matters because of its current situation around its environmental location. And we cite notions around deforestation, pollution, and climate change. And we use that to graphically paint a picture of a country that is critical for global pandemic preparedness and response. We further buttress what the Honorable Coordinating Minister did point out around the incessant, frequent, often concurrent, and, like we point out, intersecting outbreaks. We're seeing it cross sectors, and we see them give some kind of intertwining feature that needs to be addressed. We further buttress, as partners have highlighted, the circumstances around the health workforce, the Jakba situation, the immigration, and all that is happening in that space. But we do not portray just the gloom of it. In our context and background, we talk about the possibility and that it's not all grim, as the Lancet Commission of Health in Nigeria does point out. We further on go because the application is well purposed at finding very objective markers for the gaps. And in doing that, we identify the gaps based on standardized national health security assessments. Specific reference is made to the JEE, both conducted in 2023, most recently, but we give some kind of trajectory of where we came from 2017 and the midterm evaluation done in 2019. We also look at the state party self-assessment annual reports, the performance of veterinary services pathway reports, and a host of other national assessments. These give us very solid, numeric, quantitative, and if you could say, even qualitative dimensions to understanding our gaps. Drawing from that, we are putting forward a proposal that talks about the interlacing priorities of the pandemic fund around the workforce, around surveillance, and around laboratory. Regarding workforce specifically, we speak to the skewed distribution of the public health professionals across the states. We speak to the limited reach of training platforms. We speak to the limited capacity for implementation using the One Health approach. Regarding surveillance, we flag up the challenges regarding our reporting platforms that need to be strengthened. We emphasize the limited capacity for predictive modeling if we're to bring in prevention as a fore and be able to forecast ahead of disease occurrence. We look at the very pain points in our surveillance systems, especially as they interpret how linked and connected the environment, the animal health, and notably wildlife is emphasized. Around laboratory, we speak to specimen transfer and transport. We speak to the detection capacity, and we look at various gaps, especially across our sub-national units, what's happening in our states and within the communities. Ultimately, our proposal stands in saying that we will be, through investment of the pandemic fund, additively contributing to strengthening collaborative multi-sectoral pandemic prevention, preparedness, and response capacity through enhanced surveillance, laboratory systems, and health security workforce at national, at subnational, and importantly, at community levels in Nigeria. Our proposal is therefore very specifically targeted at strengthening capacities for workforce, early warning and surveillance, laboratory thematic areas, evidenced by maintained increase in the JEE and the SPAS scores of selected indicators by 2027. A second objective is to improve capacity and establish formal systems for cross-sectional coordination of workforce, for surveillance and laboratory functions, for infectious diseases, notably zoonotic diseases, by December 2027. And a third objective of our proposal, and one we try to articulate very clearly, is that it would help us improve investments in pandemic prevention, preparedness, and response in Nigeria by December 2027. It's very much in keeping with the move towards advancing notions of fund pooling and activities at both national, subnational, and community levels. I would allow Dr. Mahmood to come and take us on the last bits of the presentation.
So the writing committee selected specific indicators so that we have a defined scope in terms of what this proposal will focus on. Critically, the 3 areas that had been prioritized by the Pandemic Fund for this round are also the 3 areas that have been selected for focus. But within each of those areas, there are indicators where Nigeria had been assessed, and we saw that there was really opportunity for improvement, as well as coherence in terms of the overall theme of our application. Importantly, we want to strengthen that early warning surveillance function under surveillance, improve our ability to analyze the data for surveillance and share that information, and strengthen, particularly for animal health, our quarantine and border health abilities. In addition, we're enhancing surveillance and early detection also within the animal sector by also strengthening surveillance for zoonotic diseases. Under the laboratory theme, we were looking at what do you do when the sample is collected? How do you strengthen the ability to get that sample to a public health laboratory quickly? How do you ensure that it is safe in terms of biosafety and biosecurity when that sample is handled, either the person transporting or by the person testing? And then when that sample is in the lab, you also want to ensure that the testing capacity is in place so that you can get an appropriate diagnosis. And that's really important when you're getting many samples, high volumes of samples coming in from large outbreaks and pandemics. Under workforce, we saw this as really the foundational piece, strengthening that ability for both our surveillance and laboratory efforts, and ensuring that we're not just focused on one-off training efforts, but ongoing continuing education to ensure that people continue to maintain those capacities. And our results framework, we are able to then measure the investments we make in these areas by using the results frameworks. We start off from the scores that Nigeria obtained in its last assessment, and then project that over a period of a few years, if these interventions are implemented, would lead to at least a maintaining or even increasing those scores. And we're trying to get from having capacity towards really having developed capacity. And if we're able to even go beyond that and have significant domestic investments in financing, we should be able to reach sustained capacity. The other thing we're going to look at is not just measuring our capacity through assessments, but we also want to look at our performance when an actual outbreak happens. And the 717 framework is available for us to use to see, are we able to detect very quickly within 7 days? Were we able to notify to the public health authorities within 1 day? Were we able to complete early response actions within 7 days? And in the last year, Nigeria has had about 35 events where this approach was used to assess, and only 43% of them were done within the 717 target. This gives us a strong baseline for us to see annually whether we're improving our ability to actually perform well when outbreaks occur. Like every other project, we will implement project progress monitoring, and we shall also ensure that the learnings that are happening, including cross-sectoral learnings, are appropriately documented. This slide is supposed to be complicated, but it's also supposed to be a single slide you look at to really understand our application. Our strategies in terms of training, investing in rolling out surveillance platforms, and improving our sample transportation systems would then feed to short-term outcomes and ensure that we end up with the intermediate results that I mentioned, where we can actually see discernible changes in our scores when we are assessed. Our midterm outcomes start to integrate those efforts between laboratory and surveillance, and by our long-term outcomes, we expect to see a functional national early warning and integrated infectious disease surveillance system. The impact of this should be a reduction in the economic, social, and health harms of outbreaks and pandemics. Thank you for your attention.
Right, thank you very much, distinguished panelists from the Secretariat of this application. All right, so we've been paying rapt attention, I believe, to this conversation. And I think it's left for us to just take some few minutes. Perhaps there is any question or something to clarify or some thought. I can see Dr. Coker, am I correct now? Okay, great. Media, can someone help with a roaming mic? The Honorable Commissioner for Health, Ogun State, would like to start the conversation with a quick feedback. You have the floor, ma'am.
Thank you very much. And once again, good morning, everyone.
Good morning.
Thank you for that presentation, very detailed. I can see a lot of work has gone into it. But as my colleague mentioned earlier on, we are the implementers. I saw the steering group, which is headed by the minister, and then the National Technical Committee, which is headed by the DG. But when I looked at the composition of that, I do not see any state representation, which then means that decisions will be made and cascaded to us to implement without actually us having an input into it. And also what we were discussing here is there going to be a state technical working group as well? We didn't see that in your governance structure and would like you to elaborate on that. Thank you very much.
Thank you, Dr. Coker. So we take note of the question so you can reply. Okay, the Vice Chairman wants to also make a contribution.
Yeah, thank you very much, and I wish to congratulate the team on the detailed work that has actually gone into this. I've aligned with the comments made by my colleague, and I also want to just find out although of course we've mentioned summers and everything, but then is there any role, or let me say, how do we intend to strengthen digital technology in all of this? Secondly, the establishment of additional public health labs. Despite the fact that, yes, samples are actually batched and transported and everything, but I think it is very clear with the experiences that we've had, the need to have at least, if every state doesn't have, or at least to have some regional pH labs that will be able to, have the capacity to do all the elaborate testings. And then finally, issues around data triangulation, surveillance, immunization data, and others, because that need is actually there. Because sometimes we'll have a very good immunization coverage in some aspects, but then, of course, when it comes to get an outbreak in the same locations, I think this problem of them not speaking to each other is also something that we need to look into. Thank you.
Absolutely. Thank you very much, sir. I think we have a couple more, but I want to believe that we still have 2 more panel sections. Some of this conversation definitely will still be addressed. Let's get to Minister of Agriculture, Federal Minister of Agriculture and Food Security. Doc, you have the floor, sir.
Thank you very much. Let me also, at this point, congratulate all of us for being here.
Do you mind to introduce yourself, sir?
Okay, my name is Dr. Samuel Anzaku. I'm a chief veterinary officer, stroke the director in charge of veterinary public health in the Ministry of Agriculture and Food Security. Just a quick one. Sir, I think with due respect to this gathering, I think there's a little bit of an omission. And like we talked about, the issue of having one health structure in this application. I don't know whether it is because of the very short notice. I would have loved, just like we have our respected commissioners of agriculture, we have one or two representatives of the commissioners of agriculture from the state. Because it is very crucial, because at the end of the day, they are the people who are going to implement this program. If for the purpose of time, there was difficulty, I think even the FCT, our next door neighbor here, should have been invited, so that when we have this impulse like this, it can be sent across the whole country, and it becomes like a national document that is acceptable by all. Secondly, I just mentioned to the moderator earlier. I think it's good to just mention it so that we don't go here with a wrong impression. Incidentally, if you observe, though it is not too important, but it's important to bring it out. The moderator, I don't want to blame you. Everybody was invited to come and snap with the coordinating minister of health. And interestingly, partners were invited, but no invitation was extended to those of us who are from different ministries. We are here in this gathering, and I think it's important for proper documentation. It is very important, because we're talking about this issue of spirit of one health, but we've taken it in good health because we're all here for progress. I also want to ask for clarification on the issue of procurement. I saw about a couple of, Mrs. Ladende presented the structure. She talked about M&E, safeguards, procurement, and so many. I'm not too clear about it. One of the bane of project implementations in this country, when we don't spell it out properly, who does what, it becomes a problem. There'll be limitations. So I think we should leverage on past experiences in our own presentation. For instance, when we had this World Bank project for avian influenza, yes, there was a project coordinating unit in the Ministry of Agriculture, but then we have the information subsector, health subsector, but being coordinated, and we are really, really doing a lot of things, and there were a lot of impact. So I'm just thinking, maybe we need to put it very clearly in this document what each sector is expected to do, so that it's not everything that goes to the project coordinating unit. Because we've seen problems here, you see a lot of delays, bureaucracies, and other problems. So we should put it in the document.
All right.
Third, finally, sorry, I think I need to make this point. Okay. I saw a lot of those information systems that we talked about. Honestly, I think we also have a very robust one in the agri sector, and that is the NADIS. So when you talk about the SOMAS and co, we're talking about interoperability and coordination. I think it is good to also indicate it there as one of the documents that needs to be cited. Thank you very much.
Thank you very much. And again, apologies for the initial omission, which definitely wasn't intentional. But it's never a wrong time to do the right thing. I can see a very powerful Federal Ministry of Agriculture team on that row, Dr. Kohli, Dr. Salome, and all the other distinguished colleagues. If you don't mind, let's start with this. Can you move to the row behind the DG? That's too far from us. We'll be glad to have you move to the row behind the DG. A round of applause for them as they move, please. Please, let's have you to the row behind the DG. No, we will be happy to have you closer to the front. Okay, you're comfortable there. All right, Ali, we have extended this one. Apologies for that. It's definitely not to take the initial comment for granted. I think it's just some slight omission. Please bear with us. We've been in this for a long time, and we are sticking together. Okay, let's, I don't know whether you want to take initial feedback on this, or we'll take all the comments. Maybe we'll take for this first batch some feedback. Then we'll have the last one, please. Over to you, ma'am.
Thank you very much. I'll start with the comments from the Honorable Commissioners with regards to implementation mechanisms. Yes, of course, the state will be the implementing entities, and also will have coordinating mechanisms at the state level. These are things we need to look at looking at what we've been doing before and how we can improve on that. So we will also be having the State Steering Committee as well as the State Implementation Unit. But we would be discussing more. Yes, we'll be discussing more with the Honorable Commissioners to fine-tune this. And at the national level, what level of representation should be at the National Steering Committee, whether the chair of the Honorable Commissioners, at the three arms, and then at the National Technical Committee, maybe we'll be identifying one commissioner by zone. So those are things that we need to fine-tune. And like I did mention within my presentation, we'll be talking about that after this meeting. But of course, there will be states coordinating mechanism, and they will be playing a role at the national level as well. Dr. Anzaku, I also add my apologies on the omission in the gathering. The short notice was part of the issues, and we have taken note of this, and we'll definitely ensure that this doesn't happen going forward. You also mentioned issues around the project implementation unit. The project implementation unit will be made up of the three arms, and we will be requesting for the financial management from the Accountant General of the Federation based on some identified criteria. So we'll be having that. We'll be having procurement officers or officials identified with some criteria that will be developed. And they would also be posted from the BPP, depending on what we agree to do. So this is going to be a collaborative decision for us to take, but all will be part of it, the implementation unit. And within the different ministries, we'll be having the implementation units as well. Okay, I think that's it. Thank you.
So exactly. And yes, the other technical areas kind of so defined. There were questions around digital technology, public health labs, and interpretability, triangulating data. Not to preempt the panel discussion, but the details of that are in the activities that we follow in the next few hours. We have those as earmarked activities, and we're truly considered. So I think really that circles through questions and responses to current questions.
Thank you very much. I think we saw a few hands on this side of the hall. A few more questions. I think we should start from the left side of the hall, then we'll come over to the front.
Just that I wouldn't know how much time we'll have. There are a lot of hands up in the room. I wouldn't know if we have.
I think we just have 4 questions.
Maybe we'll just take 2 more. Others, if you could just help us write it out. The conversation is still ongoing, so that we can manage this time. We're really pressed for time now. But let's take 2 more.
Good morning, everyone. My name is Moibo Williams. I work for the German Development Corporation, GIZ, supporting a regional program on pandemic preparedness. So I think this is really a great one, a brilliant initiative where all stakeholders have come together to, talk about this application. I would have wanted to delve into the side of digital surveillance, but I think since we say we'll have a panel session where we'd go into that, I want to go back to the workforce. I think it's necessary in this application, from our own end, that there's a strong gender perspective to whatever we are coming up with regards to the workforce, capacity building, whatsoever. We need to be thinking gender. That would really sell the application. Thank you.
Thank you for the comment.
Thank you. My name is Agawak Bishiri from Federal Ministry of Environment. I observed something from the last presentation under scope. Under the scope, the lab aspect, you have human, animal, and agriculture. I don't know if that is an error or environment is missing that, so I don't know if it's an error. Thank you.
I know during the presentation there was a reinforcement around the inclusion of environment. So environment is actually included as part of the process.
Thank you very much, and congratulations for the proposal. I think it's very, very solid. Two comments. One is regarding human resources for health. That is one of the priorities, but indicators only shows training. So I am wondering as well, one of the issues that the states are facing more massively is the lack of community health workers, chiefs, CHIUs. So if this is considered in the proposal, that will be one suggestion. And the other one is like during the last submission that were unsuccessful, one of the key issues that is going to be assessed is the co-financing commitments. So as well, I'm wondering if this has been discussed, is this going to be part of the HOPE or the SWAP, or how is this co-financing going to be captured in the proposal to ensure that we are successful? Thank you.
I think you can respond briefly to some of the comments so that we can then, just 1 second. So. Go ahead, sir.
Good morning, everyone. I'm Dr. Ali from Commissioner for Health Edo State. I noticed during the workforce particularly, I think that's one of our bane in the management of any outbreak in our country. And I'm particularly glad that it's one of the strategies you want to use. But in the details you provided, it was skewed more towards veterinary and pre-veterinary education and all. And but we know that it goes beyond that. Are we looking at that? That it should be all-encompassing. The training should involve almost through and through. Thank you.
Great. Yeah, and maybe I would really use the Honorable Commissioner's comment to kind of preface this. So absolutely, and I would really plead your indulgence, Honorable Commissioner and most esteemed colleagues, that you know, we could look out for the details in the panel discussion that we follow. We have a number of activities, and we may not have given a good enough glimpse in our summary, but in the panel discussion, we intend to expand on our 96-paged application that gives more details. But in so saying, we are also being careful that, you know, like we were warned by one of our goodwill speakers, you know, it's not a panacea. It's not a silver bullet to solve all problems. We're not addressing all of Nigeria's health security challenges by this application. It's catalytic for very concrete and tangible activity. The last investment in Global Fund, every $1 given yielded $6 more. So we're expecting more co-financing, more funding, more support through it. And I'll use that as a segue to talk about the co-financing question. Yes, there will be good engagement on that, and we paid attention on how we have streamlined our activities for success with the application. Thank you. MC, do you want to?
All right. Can we please put our hands together to appreciate the secretarial team for this great presentation? As we go into the panel conversation, as earlier mentioned, we will get a number of answers to them moving forward. I think that would be good for this section for now. It's just an introduction to what is. Thank you so much. Awesome. Apologies, we're a bit behind schedule, but we are trying to move a bit faster now as we just take a panel section before we break for tea. And to move us into the next item on the agenda, we'll be discussing the panel with the team now coming forward. I will be inviting, and they will be focusing on early warning and surveillance activities component of this proposal. And to moderate this section, representing, I think I'm correct this time around, is still Dr. Mio Kamara. Please let's welcome Dr. Mio Kamara to the high table from the WHO. She will be moderating this section. And representing from our Ministry of Environment, I've not seen Madam Rita in the room. Dr. Rita, okay. Who's representing her? Madam Chika, please, a round of applause representing from our Ministry of Environment, Ms. Chika Pala. And then Olajide. A round of applause for her, please, as she makes her way to the high table. Thank you very much. And then from the powerful, ever competent, dynamic Federal Ministry of Agriculture, and food security. Please let's make welcome the wholesome Dr. Okoli. Thank you, Dr. Okoli, for joining this team. Dr. Miem, the floor is yours. As soon as we have Dr. Okoli on the table.
Thank you so much for this opportunity. I'm so excited for this panel. Dear panelists, as you know, we have only 50 minutes to have this discussion and then open for questions and answers. During the previous presentations, surveillance gaps, we have a wiki reporting platform, the limited capacity for predictive modeling, and the weak surveillance systems for environment, animal health, and wildlife, also in the health sector. So, and also the lack of interoperability. The Minister of Agriculture mentioned they have a very robust system, which is NADIS. I'm correct, NADIS? But how these systems are working, right? So I'd like to know from these activities were selected and why you prioritize those activities. We look into these gaps, we can sort of understand, but from each of your sectors, how and why those were prioritized. I'm starting with the Dr. Malochika. Thank you, Dr. Malochika. Over to you.
Good morning, everyone. It's a pleasure being here this morning. So my name is Okpala Chika from Federal Ministry of Environment. So actually, for early warning and the surveillance system, the ministry has actually started something when it comes to environmental health surveillance system. This was established like 2 years ago. You still need to do a lot of work to scale it up and also make up other things for training of our environmental health officers. But however, this system was established very importantly to monitor and detect some of these phenomena we have, like national disasters, like pollution controls and climate change. These things are supposed to be captured in the, maybe from the community level. We are not actually recording the diseases, but actually the events that can lead to these diseases. So it's very important that we train the environmental health officers that are down in the local government that will be able to pick up these events. And then what do? We actually want to inform and alert the human health and environmental and human health and animal health that such a thing is about to happen. That is the most important aspect of this. And actually, we also want to get this done in order to feed into other systems. We have the NADIS, we have the SOMAs that are already running. So we want to put up our own environment. Is very key to the system to be able to analyze, be able to collect this data, and also interpret it to forward onward to human and environment and the animal health. Thank you.
Thank you so much, Dr. Olaji.
Good morning, everyone, and thank you for having me here. So I would like to start from 2017, when Nigeria had the first joint external evaluation. And at that point in time, it was identified that Nigeria was not ready to prevent, detect, and respond to public health threats. And so from those gaps that you identified, of course, this informed the development of the National Action Plan for Health Security, NAPS 1.0. And the idea of this NAPS 1.0 is to be able to address those gaps that you identified. And now fast forward to 2023, when Nigeria had the second joint external evaluation. So even though there have been a lot of progress made in the first joint, during the implementation of NAPS 1.0, the JE 2.0 still identified a number of gaps that were actually in the health system in the country. And a number of these gaps actually are more at the subnational level, even though we know a lot has been done at the national, but we realize that a lot of these gaps actually still exist at the subnational level. And please permit me to mention just a few of those gaps. So one of those gaps actually has been said was the fact that, we have this human-animal environment operating in silos when it comes to surveillance activities. And as we know that about 75% of all emerging diseases are actually zoonotic in nature. So there is a need to ensure that these surveillance activities actually speak to one another. And so that lack of or ineffective interoperability or interconnectivity between these sectors, human, animal, and environment. And also, if we all cast our minds back to when we detected the diphtheria outbreak, and I think this was first detected at the health facility, but we realized that a number of our health facilities are not really involved in surveillance activities. They're more focused on, research, on training, but there is a need for them to come on board because we know the volume of cases that first present at the facilities. So we have this lack of, involvement of health facilities at the health facility, of surveillance activities at the health facilities. And also, just like I said, we also have weak indicator-based and event-based surveillance at the subnational. We know a number of cases that occur at the community level before they even get to the health facilities. So there is a need for us to actually strengthen this surveillance at this level. And as has been said, we need to move away from just detecting and responding. We need to be able to predict, forecast, so that we can put up, preventive measures actually ahead of this. So these were some of the gaps that you identified, and these were quite highlighted at the second joint external evaluation. So from those gaps and from the recommendations that you made from the JE, as well as, some other assessments that you made, all this informed the development and the prioritizations of the activities, for the pandemic fund under the surveillance and early warning. And we also saw this as the low-hanging fruits, that we can quickly latch on to be able to improve Nigeria's, capacity to prevent, detect, and respond to public health threats. And all this also need to be taken into, we also need to, these activities are also within the context, of the pandemic fund. So each of these activities actually addresses the specific needs, for us to be able to prevent, to enable the Nigeria's capability to prevent and detect your public health threats. So this was the process in the detection, in the development and the prioritization of the activities as submitted in the pandemic fund. Thank you.
Thank you, Dr. Olajide. Dr. Okoli, over to you. So picking this, what Dr. Olajide mentioned about the gaps identified in the health sector, and why did you choose, also your sector choose the specific activities? So over to you, please.
Good morning, still morning, and it's my pleasure to be here discussing this at this time. As we all know, the global health security emphasizes multi-sectoral collaborations. In the animal health sector, we have identified so many gaps. And you will all agree with me that you are only as strong as your weakest link. And if we're going to be working together, certain systems need to be really strengthened across all the sectors, including the animal health sector. Some of these gaps that we have identified are in the area of wildlife surveillance. We know, again, that over 60% of diseases are zoonotic in nature, and over 75 to 80% of the emerging and re-emerging diseases that are likely to cause pandemic are also noted to be zoonotic in nature. That means that they are likely to originate from a sector other than the human health sector, probably from the environment, and most likely from the animal health sector. We talked about the bats and the viruses they carry, and there are so many. In different wildlife species, we have threats to human health. And so we need to strengthen the wildlife surveillance to be able to detect these events when they happen for early warning purposes. And so, yes, we have captured activities to help us to strengthen the wildlife sector. We're also looking at integrating the operators around there in the trainings, and when we talked, so many people also mentioned community health workers at different levels and building capacity. And I say that when we talk about community health workers in this context, that we are talking about both the human health community workers, the animal health community workers, and even the environmental health. Because in our disease notification, it starts from the community, the grassroots. We have people working at those levels. We have hunters, we have people working at the abattoirs, we have people working at different community levels whom we need to integrate both by training and other things to be able to form part of the surveillance at that level. And then we're also looking to improve surveillance at our borders. The quarantine system, the agri-quarantine system, we have very porous borders, especially all around our land borders, they're very porous. We have a lot of migration of both humans and animals into the country. We need to strengthen them to be able to detect what is coming in. We also need to strengthen some of these other activities that we captured. Yeah, so yes, all the activities that we have captured, we have critically looked at them. They are going to be meeting one gap, one need or the other to strengthen the system for a robust surveillance system in the animal health sector to be able to timely report and give early warning and also for early action against any potential threat from that sector. Thank you. I'll stop here for now.
Thank you for our panelists. Continuing this discussion, how you mentioned a lot about we need to strengthen at community level, right? The surveillance at community level for environment, health, and animal. So through this funding, how you can strengthen the surveillance at this level? And also, we talked about the interoperability of the different systems, that you have very strong systems, how this will be integrated and interoperable across the different MDAs to provide this real-time information to be really be able to act according to the 717 benchmark. Thank you.
You're asking me? All right.
Let's start now from Dr. Yes.
Okay. So thank you. That even helps me to remember something that I skipped. The NADIS, which is our surveillance tool for reporting diseases from the grassroots, is presently being done, is paper-based and like a hybrid. So one of the activities we have captured is to upgrade the NADIS and make it more digital, and that will also help in interoperability. You will agree with me that paper-based reporting will not fit into that. So yes, one of the activities that we have actually earmarked for this is to upgrade the NADIS into a digital form. Thank you.
Thank you, Dr. Lois.
All right, thank you so much. So some of the ways of strengthening surveillance system, as Helen mentioned, is, we've identified the different digital platforms for the human, animal, and environment. So we have the SOMAS for the human, we have the INS, and we have the NADIS. And we know that there is a need, when we're saying that there is need for interoperability, there is a need for these systems to speak to one another. And when they speak to one another, first of all, there is a need to identify what is the data sharing, mechanism that is in place. And yes, we know there is this mechanism that's been developed at the national level, but there is a need to also realize that all these outbreaks occur, just as been said, at the community, at the state level. So there is a need for this, at this level, to also identify what is the mechanism for these data, these systems, digital systems, to actually speak together. what are the variables that will speak to one another, because you can't just put everything in. So all this actually, when we're talking about interoperability, so these are some of the things we're talking about. And also, when we're saying strengthening surveillance system, as we know, we have SOMAS deployed in the states and the Federal Capital Territory and the local government areas. But we also have some levels that are still reporting where it's still paper-based. And if there is a need for us to actually ensure that there is prompt reporting from this. We have the health facilities, we have the communities. There is a need for us to ensure that they have this digital real-time reporting at these levels, the primary, the secondary, the tertiary, and even the private facilities, looking at the volume of cases that actually present at these private facilities. And then we're talking about community-based surveillance. Outbreaks do not just occur suddenly, they occur at the communities. So there is a need for us to strengthen community-based surveillance. Yes, we have the community-based strategy that's already developed, but there is a need for us to actually implement this, and this can only be implemented at the community, training. We have community case definitions. There is a need for us to train all these community workers on this community case definition for them to promptly pick up and report this. What are the reporting tools that will be used at this level? We have the Avada system. This is also a digital system. We also have the event-based surveillance system that is, that is being used. Yes, this is strong. This is already developed at the national. But if we don't strengthen, and this was one of the main recommendations from this JE, the need for us to strengthen our subnational level for them to promptly detect and report. So there is a need for us to actually strengthen event-based surveillance system at this level, and we have different, structures. We have the Tatafo, we have the, the call center, we have the AIOS. So there is a need for us to actually strengthen, all this at the subnational level. And other things, we have the feedback system. We want this, this feedback system, both from the national to the subnational and also vice versa. So these are some of the ways of actually strengthening, the surveillance system. And last but not the least, there was a mention on the data triangulation, the need for us to actually look at our various data and triangulate them and make informed decisions. We're talking about the surveillance data, we're talking about the vaccination, data, we're talking even environmental data. We need to ensure that we can triangulate all these different sources and let them inform the decisions and actions that will be taken. And we don't want this to only be at the national, but there is a need for us to also ensure that we have this at the subnational level. Thank you very much.
Thank you, Dr. Lois. Dr. Chika.
Okay, thank you very much. We are all speaking about interoperability, but then the Ministry of Environment, our INS, which is National Environmental Health Surveillance System, it still needs to be fully digitalized. So we need this to be fully digitalized to scale it up in order for our environmental health officer that at the state level and at the local government level to be able to input data. Already through the platform of Redise, we were able to train states, only 12 states. And among the 12 states that we are trained, we still need to do a lot of training. So we also need to build the capacity of these environmental health officers that need to put in these data in order for us to get it in real-time data. As well, apart from having this recorded, we also have lack of advanced technology. Most of these environmental health officers don't even have the, the technology they need in order for them to put these data in the platform. So I think there is very much a long way to go for us in order for us to also talk of bringing every one of us together. The remaining states that have not done their own training and also retraining of these environmental health officers. They are actually doing, most of them up to now, are actually doing paper-based. Even though the system has started bringing in some data that from the 12 states, but we still need to scale up to other ones for us to be able to be in the same page with other One Health colleagues. Thank you.
Thank you very much. Now we are going to open for questions from the audience. So could you please raise your hand? Yes. And is there a mic for the... Yes, Dr. Tijoke.
Okay, there you go. So thanks very much for the very insightful conversations. I have listened very intently, and I know there are still many more things, if you had a lot of time to talk about, you would be willing to discuss. So gaps and technical interventions sometimes are very straightforward and linear. So you have weak surveillance systems, strengthened surveillance systems. You don't have interoperability of the information platforms, make them interoperable. So they look very linear. If we apply that criteria, trust me, we'll get to the point where the whole problem of health security in Nigeria is on this pandemic application. Question to you, as you consider the activities in your sector, did you think of anywhere else, anyhow else you could prioritize? The pandemic fund is supposed to be catalytic. So, in other words, you want to use it to touch something that will jump frog or leapfrog so many other things. You want to touch low-hanging fruits. You want to use it to complete something that once we put this, it becomes like that last drop that makes things work, and so on and so forth. So have you thought of any other way to kind of prioritize the activities that are already prioritized, because they are not frivolous activities? They are important. They are important activities without any question. Can you think of anywhere else to do that? The second point is, these activities, to the best of my standing, are not yet costed. So there will still be, inevitably, a reprioritization process. In other words, we start to put the money, there's a cap. I mean, it's about 25 million USD. I'll imagine that the country might get up to 24 point something. So, I mean, if you send me a budget that is 25 million, I know you just put lump sums. But if you reach 24, 35, 50 kobo, here, I know that there's a little bit of calculation and breakdown that went into it. So I would imagine the country will get up to 24 something like that. There will still be a need to reprioritize. And it's important that even now, as we speak, that all of the different sectors involved in anchoring these activities begin to think about that. What is it that is really something that this fund should go to amongst all these priorities and gaps that has been identified? I have many other comments, but I don't have to keep the mic. Thanks.
Thank you, Dr. Chijoke. Any other hand? Yes, over there. Yes, here. And then...
Thank you very much. Thank you for the robust discussion. There's a gap that I see that I didn't really see that you explored, and currently the disease surveillance notification officers are partly funded. In my state, I can speak for that. They are actually clinical nurses that then do surveillance once a month. That can't work. So what we have taken a step to do is actually decide that it's either you're a disease surveillance officer or a clinical nurse. And I don't know what pertains in other parts of the country, but I think we could look at that to actually have disease surveillance officers that go out daily and are equipped with electronic platforms that you have talked about. It could be a team of two, so that it's consistent, or the interoperability, but it has to happen on a daily basis. It can't be ad hoc once a month when I'm not doing anything. And currently, only half of our facilities are being reviewed, because that's what the WHO fund, that funds it, covers. So if you have a local government that has 10 wards, you get 5 out of the 10. And lastly, the stipend. It is a stipend that is not working because it's historical. And they don't bother going because it's not worth their while, because petrol is expensive. So I think that's a practical way. If we can truly go out and survey our community in a consistent and reliable way, then we'll start to see the patterns. And reporting, sort of, contemporaneous reporting, not that it comes a month later. Thank you.
Thank you so much. Let's get the last question there. Yes, and then we allow the panelists to answer. Yeah, please. Okay, sorry, Dr. But I didn't see your hands. Yes, please go ahead, Dr. Badar. And then we have quickly, because we are already running out of time.
Thank you very much, the panelists. That was a very wonderful discussion. My own point of view is that when you look at the premises where you are coming from, when you talk of preparedness, prevention, response, detection. When you look at these premises, looking at preparedness, for instance, we talk of this early warning. I think there is a gap which you need to identify. That is with regard to meteorology, to know the weather, which will incite people on some diseases that could occur during this change in the weather condition. So this is very key. You need to also key into your plan to see whether you can early detect and be able to respond. Then we talk of the issue of prevention. You know, information is for action. There is need for you to have at the grassroots level those workforce that you will need to build for them to carry out a program that will prevent people from getting exposure either to the animal disease or to the human disease. At that level, maybe by creating awareness and also sensitizing the people at that grassroots level. That need to come up in your plan as well. When you talk about the issue of response, yes, information for action. We have the hierarchy at the grassroots. Containing the outbreak at the grassroots at a very instant time, immediate time, save more life, save more cost, save a lot of things. I think you need to prioritize strengthening the response at the grassroots, whereby we have the RRT, or if we can have the EOC at that level, and that will work better for us. Thank you.
Thank you, Dr. Badaro. Yes, last one there, and then we allow the panelists to answer.
I discovered that during the presentations, the animal health, the woman health, and agric, they talk about community-based surveillance. It's like cut-crossing challenges that cut across all the three thematics, all the three sectors. Now, from the activities, one of the interventions is to establish maybe community-based surveillance, maybe in 10 remaining states. I think at this point it would be good for us to look at the three sectors, come up with an idea to see how we can establish community-based surveillance systems that captures all the relevant data and variables at the community levels, and that feeding into different systems. That will help us to be able to establish this one health concept even at the community levels, at the communities, where we don't even have many people that can do the works. We can leverage on that and have like a systems that can help us to be able to gather the data at the community levels, and that will help us. At the point of implementation or sharing data, there can be different pathways of doing that. But if you can look at the strategy and the concept of bringing all these things together and have a robust community-based surveillance that bring all the sector together, I think that will be cost-effective and is going to help us in moving forward. Thank you.
Thank you, Dr. Benga. Sorry, we are really running out of time. I think now I give the floor to the panelists, starting from Dr. Lois. Yeah.
All right, thank you very much for the questions. I think majority of them are actually comments, and I'll try to address them to the best of my ability. So when we're talking about surveillance at the subnational level, please permit me to say that surveillance, and pardon me if it's not something, so surveillance is actually the sole responsibility of all the various levels, and we at this point, I think there is a need for us to start, thinking about sustainability. Yes, we know, a lot of partner support and all that, but at some point, all this support will come to an end, and there is a need to, it's we need to really talk about, state ownership, community ownership. And so even for this pandemic fund, at some point, that fund would definitely, it will finish. So we actually, should look, innovative ways of ensuring that, surveillance at these levels are actually sustained, beyond the support from all the various that's coming in. And yes, I totally agree. Surveillance is supposed to be done on a daily basis. And so we would also, I would like to throw it back to you, Ma, to ensure that, the state actually, goes along, supports this surveillance, in our respective states, such that these disease surveillance and notifications officers don't just go on a daily basis. If the state can also provide, more resources, to support them to ensure that they carry out their duties as they should. And yes, I totally agree on the issue of the community-based surveillance. And one thing we're looking at is to ensure that when we're talking about interoperability, we're not only talking about, the digital systems. There is a need for us to also talk about, interconnectivity when it comes to those actions, when it comes to surveillance actions. And so when we're talking about human, animal, environment, and even at the level of the community-based surveillance, there is a need for us to also have that interconnectivity with respect to the detection and the reporting platforms that you use. So I think I totally agree. And looking at the prioritization, how did we go about that and all that? So I will say that, beyond looking at the scores, beyond looking, at, what are the gaps and all that, we also looked at, what are those, programs, what are those activities that you would have the maximum impact, with this fund. We looked at which ones are really feasible within, the context of this pandemic fund we have and within the time scope that we have. And if we start talking about all the activities that are actually captured, I'm sure 1 hour will not be enough for only, surveillance and early warning. And so we also looked at those, the activities with the maximum impact and the activities that are most feasible for us within the sphere, that we have. Thank you very much.
Thank you, Dr. Lois. Dr. Chika, for you, over to you.
Okay, thank you very much for the questions and comments. I think I will start with that of trying to prioritize. For us in the environment, the INES is very key to us. I will use the example of the unknown disease in Zamfara and Sokoto. Of course, this affected the environment. But because the environmental health officers, the states are not quite, will I say, involved in this, they don't really know much. I had a brief interaction with the Zamfara State Sanitation Desk Officer, the Environmental Health Sanitation Desk Officer. I noticed that he's not quite aware. And then that of Sokoto's, maybe because they're interacting with their One Health partners, he was able to give me some information. Remember, we got this information not from any of them, getting to us, but because from one platform or the other. But if this INES is working, I believe as they're getting this information from their local communities, they should be able to send it down to us and it get to us. So it's very key to us for us to be able to prioritize this INES. I remember I mentioned that we have already done a training for 12 states. So it's also important that we try to scale up to other states so that everyone will be at the same page. Then the commission I mentioned about having the disease surveillance system. For us in the environment, we have the sanitation desk officers that we have in all the 36 states. And they are actually doing their work when it comes to sanitary inspection of premises. But however, they lack a lot of resources. But human, they are not enough for them to go to the communities. So these are things that has been their routine activities to do, but we still, as for government level, we still need to improve in their mandate, their workforce, their funding as well. And it permits me to say that because the environment, anything that happens in the environment, we don't see it much physically. Sometimes it triggers off to cause diseases to the human health. A lot of us are not seeing the environment as a key problem. And I'm telling you, there are a lot of health determinants that are coming from the environment. So it's very important that we look up to, trying to prioritize our INS, which is the most important thing we needed for this funding. Also, we mentioned about early warning. The ministry also has a system, we call it FUSE, Flood Early Warning System. It just started like 2 years ago from the Department Flooding System, whereby they give alerts, they forecast on what is the flooding, the weather system. So we still need to, try to come up with these things in the same system so that one can be able to detect what will happen, the flooding that can happen, the diseases that can emanate when flooding takes place. I think that's what I have, and thank you, and over.
Thank you, Dr. Okoli, quickly to wrap up.
Thank you very much for all the comments. I noted them as comments and not necessarily as questions. But I just want to address one or two things that during the preparation and prioritization of the activities for the animal health sector, this pandemic fund is supposed to be used for the strengthening of already existing structures and systems so that they can be sustainable. So, and they were critically looked at. We took away so many things, but we emphasized on the areas that we feel really need to be strengthened. Like I earlier said, no matter how strong we are only as strong as our weakest points. So we need to bring everybody at par so that we are responding at the same level, at the same time. So strengthening the systems to be able to have real-time reports from states, from communities is very essential for early warning, for early response. And already we have teams, rapid response teams at the state level, which we also need to find a way of, stepping it down to the communities so that the community animal health workers, the man who is working in the abattoir, which is a sentinel point for surveillance, the man who is working at, the different points, the hunters, for example, those who are trading in wildlife, that once they spot something, they're able to send it up instantly, and we're able to pick it up using the improved and digitalized NADIS system that we are looking to improve so that we can see these things even before they come in. We can stop it at the animal health sector. It doesn't have to get spillover to the human sector. And even if it does, the human health will be right there to pick it up at once and contain it. So we have looked at the activities that we have prioritized, and we think that it is critical if we're going to really be able to prevent or detect or respond to any known or unknown pathogen. Thank you.
Thank you very much. I was just informed that we were granted more time, which is good. So let's give the floor. Yes, we have 1, 2, 3, 4. Chijoke, I will leave you to the list because you had already one opportunity. So let me give you opportunity to the others. Yeah, 4 hands for now.
Yes, hello, good afternoon. I had a quick question. I noticed one of the slides.
Could you please just tell who are you?
Sorry.
Yes,
my name is Vivian Hikwazu. I'm the Managing Director for Nigeria Health Watch. I had a question. One of the slides presented collaboration with other entities, and I saw one of them was the private sector. So I just want to ask, in terms of thinking of co-financing sustainability, how are we integrating the private sector in all the application for the pandemic application fund? Because I think it's very critical. We had some important lessons from COVID-19, where we had COVID, a very viable vehicle through which funds were channeled through to respond. So how are we integrating the private sector? Because I don't really see any specific organization or entity here that would speak about the role of the private sector. Thank you.
Thank you so much. This panel is technical for surveillance. I would like the questions to be very directed to what was here in the discussion on this panel. I think this comment is more related to the previous presentation. I would suggest you to reach out the Secretariat to have more information about this. Is it okay? Okay, thank you. So next, yes, please.
Yeah, thank you very much for discussion so far. I'm Dr. Okechukwu Amako. I work with the Clinton Health Access Initiative. My question is around whether we've thought about or to include social media, for example, as a source of signals, surveillance signals, and then whether we are thinking about collaborating with the Ministry of Communication and Digital Economy around that. So within this aspect, delving just slightly deeper into my question is around how do we incorporate like self-reports from individuals, right? So for instance, you made mention of maybe it's, at the abattoirs, for example, something is identified. Just look at it where the person working at the abattoir doesn't dictate wherever is the problem, and then someone buys this meat, cooks it in the family, they eat, and then start developing some health issues. So is there a way to sort of like incorporate, give these people the opportunity to sort of like self-report what they're experiencing following the consumption of something that they bought at the abattoir? And this is where event-based surveillance through self-reports, through social media could sort of like be very important. Thank you.
Thank you very much. Next. Here, in front. Yes.
Thank you. Good afternoon. My name is Elsie Laurie, and I'm representing the SEPI. But maybe I was also part of the surveillance team. You know. So, but I just want to suggest for the triangulation, well, I don't know if MPHCDA is here, but I think they should be here. Okay, thank you. So I know they have Avada that they used for their immunization data. So if we could work with them, because it's very, very important. I mean, we have had situations where we had gone to international forum and we were presenting measles data was going up, and then they were also showing that measles immunization was 95%, and so we were so embarrassed. So we need to really work on that. I'm also suggesting that in the capacity building, for community level is very key, and we should have an integrated approach to the training. So that is where we bring all the sectors together. So any training we're doing at that level, please, let's make it integrated. So we can also use those from the animal health sector, the environment, to look for our data, for surveillance disease data. And the other part I'm looking at, the integration. I think Dr. Badaro mentioned that integration should be at the community level. That is where we start looking at the data right from the community level, sharing data with the sectors at the community level. So let's look at that, please. Thank you.
Thank you, Dr. Ilori. Chijoke, here, the microphone, yes. Over to you.
Thank you. My name is Chijoke Okoro. I work with the World Bank. I wanted to piggyback on what Dr. Coker mentioned with the surveillance aspects and the role of the state and the needs at that level, to then kind of push a bit on one of the things that is expected with the fund, which is to use it to think outside the box a bit. So, for instance, it would be really helpful if there is some kind of standard that is set up by, say, NCDC in this case, of what EPR departments should look like at the state level. So, in fact, we can actually report out on a yearly basis states that have met specific standards. I know she's pushing and she's eager to do something, but there are, can we, in fact, push on that kind of thing? I know it's surveillance specific we're speaking to, but these are the governance aspects that kind of impact on our ability to then do that. You know, can we, for instance, have that? That's a little bit of thinking outside the box of the traditional patterns. Even for the state level, man, you need the funding to be able to do things. Can we even start to push on that? Like states set up an EPR fund, Emergency Preparedness and Response Fund. We've heard that in some other places, when it is backed by law, it's allows the fund to be flexible such that you can roll it from year to year without necessarily have to be under pressure to finish spending in any budgeting calendar year, and so on and so forth. So there are a few things in this way that can help, but it will require thinking a little bit outside the box in that sense, and making things very concrete that states can do. I see maybe you already overtaken that as a matter of fact, but I'll stop here. Thanks.
Thank you. Yes, Dr. Oladejo, yes.
Oh, thank you very much. I think what Dr. Chijoke is saying, we actually submitted a document to National Council on Health. That was 2022, that we should have APR at state level, and this APR should be funded. This was actually agreed by all the members of the council, but up to now, we are still pushing through Federal Ministry of Health, Department of that is Department of Research and Statistics, but this has not occurred. But I believe with this pandemic, we'll be able to push it again and maybe write the state again, because when I check from the Department of Planning, Research and Statistics, I think only 1 or 2 states is actually complying. So we still need to talk to the monitoring and evaluation units of the National Council on Health to make sure that at least we do that, because when we're talking about preparedness, we really need to make use of these units. Thank you.
Thank you so much. Yes.
Thank you very much. I think there's a lot of learning from CoPrep on this EPR, because as for all of us, we're just talking, the first quarter of this year, we actually used the CoPrep to support our EPR. And some of my states, we've actually decided to have EPR to sustain what CoPrep has done. And if we could standardize across the states, I like the idea of actually making it into a law, because I've realized in Nigeria, if anything is not in law, we tend not to follow it. So maybe this is where I said the state should be involved. We should have been involved earlier than this, so we could have contributed a little bit more to the discussion, to the application. Thank you.
Thank you so much. Are you the last? Okay. Here, we have, yes, one contribution here. Huh?
Okay. My take is it's not specific to surveillance, but generally I just apply. Usually what we have observed, or what I have observed, is the World Bank, or most of this fund, when it comes, they seem to have what they want us to do with the fund instead of being the other way around. Can that change at this, with this, for us getting it and actually seeing what we feel, what the gaps are in our own system, and actually addressing those needs? I don't know if you get my point.
I think the DG NCDC, okay. Okay. So just as a little bit of, okay, go on, please.
Yeah. Are you answering, or?
Do you want to provide an answer?
Yes, I
was going
to
because we have another hand there, and then we need to wrap up, right?
We're actually done with it.
Okay, yes.
Thank you very much. Good afternoon. I'm Dr. Marin, the State Epidemiologist of Plateau State, representing the Honorable Commissioner for Plateau State. We have the community informant, then we have the disease surveillance officers at the local government level. Now, to talk about strengthening the event-based surveillance, during REDICI, some equipment were distributed to the states. Some of the states, I don't think it's all, the states that receive those communities, is actually for Connect Center. and that's supposed to strengthen event-based surveillance, whereby individuals can call some certain numbers that will be distributed, maybe through the radio stations, to report directly to the EOC at the state level. I think if we can leverage on that, it's going to help a lot. But as of now, those people that are supposed to operate those connect centers have not been trained. So I think that can also be strengthened. And I look at some challenges also at the local government levels, the DSNOs. At a time past, the WHO, World Health Organization, supported the DSNOs with some motorbikes, whereby they used those motorbikes to go to difficult areas, and with the security challenges, now it's difficult because those motorcycles are not in operation. And I think if they can have that again, we are also engaging the WHO at the state level to see whether those can be done, but they can't have funds for those. So I think that is going to go a long way. Since we are talking about early detection, it's going to go a long way. Thank you very much.
Thank you very much. Let me come back to the panelists because we are already out of our time. So yes, let me start with the Chika. Now, over to you.
Okay, thank you once again. I think I just have few response. Most of them will be going to NCDC. I just want to respond to Dr. Yuli's point where you mentioned about training of people in the community level. Yes, from the environment angle, we appreciate that once in a while we are called upon to join the trainings like the ITSIN, the advanced and the intermediate FLT. And I want to use this forum to also say that we might need to increase it. Like the Oliver Twist said, we want some more. Dr. mentioned that your weakness is as well as your weakest link. The environment has been weak in that surveillance angle. So we want to use this forum to also say that as much as, because we see a participant of 50 and you are just having environmental health officers, maybe 2. So that will be very important and very key for us to be able to feed into our surveillance system. Thank you.
Thank you, Dr. Lois. Okay, that's over to you.
All right, thank you very much for the comments and the contributions. For Dr. Kukama, I think one of the objectives of this dialogue is to hear back from the stakeholders, so we'll definitely take it back based on some of the activities you've actually mentioned. We'll take it back to the forum and it will inform the review, of the activities that have actually been identified. So thank you for that. And so with respect to the calling and the use of social media, and one of the activities, as earlier mentioned, actually is to strengthen event-based surveillance system, especially at the subnational level. And some of our various media of event-based surveillance, we have the call center, we have the Tatafo, and we have SMS, WhatsApp, and all that. And so if I could recall, I think 2022 or thereabout, there was a needs assessment that was done at the subnational level to know the level of the event-based surveillance structure there. And so that informed, the deployment of event-based surveillance at the subnational level. And yes, you are right in the sense that there's some of this equipment that have been deployed to some of the states. And so we're hoping that with this fund, we'll be able to go ahead with the capacity building so that, we can actually, start implementing the same event-based surveillance at the subnational level. So we have, even at the national, we have a lot of people calling to actually, to report some, any outbreak or any disease actually, or any public health event. We actually have, specifically, if I could recall, the Tatafo, some of these are some of our event-based surveillance medium actually get their data
from the social media. For example, Tatafo, I remember we have the data from Twitter, now X, Facebook, the feed into our, Tatafo system. So yes, there is, we are making use of this, and yes, it's quite strong at the national level, but just like I said earlier, all this actually happen at the subnational, the communities, the states, the local government. So we want the situation whereby they will be well structured for them to make use of the systems and quickly, detect and report all this, and then which can now be escalated, and the necessary actions, investigation to determine whether it's actually a true signal or not, and then it's now escalated to the appropriate quarter. So that is actually one of the the plans in for this pandemic fund. Thank you.
Thank you, Dr. Lois. Last but not the least.
So thank you very much. I always want to emphasize the One Health collaborations. At the national, we seem to be doing well, but at the subnational, that's where we really need to strengthen these multi-sectoral collaborations. It's not a collaboration of leader or on an equal basis, the animal health, human health, and environment. And so the EPR at the state levels that we have been talking about are supposed to be very at the forefront of the One Health. And that is really why it's a pity that it's only the commissioners of health that are here. The commissioners, just like my boss had earlier mentioned, for agric, or at least the directors of veterinary services should have been here, both at the national, the subnational, at every level, so that we're speaking with the same voice. As we live here, we get to the states, we are already talking, we know where we are going to strengthen that. And this activity has been captured in our proposal to strengthen multi-sectoral collaborations at the states and even up to the community levels. So that will also strengthen community-based disease surveillance and all that. So at the community level, where we have most of our sentinel surveillance points for the animal health sector, we talk about the abattoirs that was mentioned. Yes, one of our activities also seeks to strengthen that in a One Health, using a One Health approach, and to train and build the capacity of even more people in the community to be able to report events that are happening there. We don't nearly have enough surveillance agents, so we need to train more, to increase the number of surveillance agents at that level, to be able to report if there is anything that is happening at the community levels. So these are some of the activities we have also captured. And that will be able, then we have surveillance agents at the abattoir, for example, but we don't have enough, so I don't think we have in all the abattoirs. So when there's something happening there, and it's a very important point for picking zoonotic diseases that can easily affect us. We don't have enough. So this fund, we're looking at training more to serve as community informers at the community level. And as we integrate them as a One Health team, starting from the community level going on, because these trainings are actually supposed to be done jointly, integrated trainings. So they know each other, and I believe that it will strengthen the reporting from the community upwards. Thank you.
Thank you so much. We are in the end of the panel. We discussed a lot about the importance of engaging, involving at community level, informants, workers, grassroots organizations on how to improve the surveillance. Also, the importance of each of the sectors, agric, health, and animal, to come together and work in a collaborative way under the One Health approach. in this framework to really achieve the same goal, because in the end, what we want is to have a better health for the Nigerians. These include having good environmental control, good animal health control to provide good health for the Nigerian people. So a big clap to our panelists, and thank you so much for your collaboration. Your inputs will be also integrated into the documents, and this will enhance the power of our proposal. Thank you so much.
Absolutely. Better warm round of applause for the team. Can you just step forward a bit for group photograph, the panelists? Cameras? Don't worry, the camera will come. All right. I hope somebody is happy that we are gender sensitive. Oversensitive. Okay, now it's insensitive. All right. Okay, thank you very much. Thank you very much. A better round of applause for them as they make their ways back to the seat. Thank you, Dr. Mayor, for that wholesome section. All right, just before we break for tea, let me run us through this quickly. After tea, we'll be breaking for tea for about 30 minutes. After tea, we will be back to combine the next two panel sections. We'll take the discussions together and we'll be out of here shortly. Please bear with us. But not until we have had the reflections from the Director General Nigeria Center for Disease Control, who will be bringing forward what I thought so far so good. Please let's make welcome the DG.
Yeah, ladies and gentlemen, well, it's not a reflection like you said. I don't know who gave him that idea. I just want to say that as if one of the feedbacks I've got from here, especially from the state commissioners, I need to leave here shortly. Not because I want to leave, but because I'm being called at the house. I've evaded it 3 times. I can't evade it today. But I must say that at least the feedback so far have been very, very enlightening. And I think this is precisely what we try to do today. But a couple of things came out of it. I'm going to the House to answer some queries. But at the same time, part of the thing we want to do is to start fighting for increased funding from government. There is no way we can continue to rely on donor agencies forever. So we have to start now, and that's why I'm an apostle of. No, there's no need to clap. This is reality. I'm an apostle of where everybody has to play their politics. So as we are playing politics nationally here, I want to advise my colleagues here to do such sub-nationally. And if possible, we can do that together. Secondly, I'm taking full responsibility for the lapses expressed today, especially from our colleagues from Agriculture, Ministry of Agriculture and Environment. It was an oversight. And let me be frank with you, I wasn't too sure we were going to hold this session. So everything we did in the last 2 days. So my apologies for the lapses. It is not a reflection of, we want to collaborate. We will collaborate, and quite a number of things have come out of today. As a matter of fact, let me use this opportunity again. Our meeting, the One Health Technical Committee, has been overdue. And what has taken so long is that I was trying to get consensus from my 2 other co-chairs, but it's been a bit difficult. But I want to use the point, can we do that this week? We plan to do that this week, if you don't mind, because the longer we prolong it, the worse for us. So I make it a point of duty actually to pay a visit to the 2 ministries very shortly. Like we did say, this is not a magic bullet. In fact, we don't even know how much they are going to allocate to us, depending on how well it is. But there are other facilities, just like the Honorable Minister said. And that's why there are so many things to do, so many to consider. You've given so many views, but there's a need for us to prioritize so that we can be more focused in our application. And finally, just to respond to Vivian, the private sector is key to us. And I think if I remember rightly on this document, there is supposed to be a section, but more importantly, CDC has a program for the private sector. I think I'm going to link up with you, with your colleagues in Lagos, on how we can go to do this. Thank you very much.
All right, thank you very much, the Director General, Nigeria Center for Disease Control and Prevention, Dr. Jide Idris. Permit me, before we break, to announce that we've been joined at this meeting by the representative of NACA, and that's in person of Dr. Inka Falola Hanoemwa. A round of applause for her, please. We also have in the room the representative of Honorable Commissioner for Health, Rivers State, Dr. Godi, the Director of Public Health. Ably supporting, we recognize all the partners in the room, but without mentioning, again, at least Nigeria Health Watch. Thank you so much for all you do. I can cite the wife of my former boss at the back. The media, thank you so much. IFRC, definitely not a vote of thanks time. It's just to recognize that we know that you're here and we appreciate all you do. If you don't mind, it would be a good time to capture this moment with a group photograph. May I kindly invite the DG, the members of the high table on the other side to please step forward. Then this is for everybody now. We want to capture the moment as much as possible, so we'll try to manage the space we have here. Media, if you don't mind to help us, I mean the graphics team, to help us arrange so that we can have a kind of group photograph to capture this moment for all of us. So if I can kindly invite the DG, the commissioners, the representative of the MDA's developing partners, please come over. All the invited colleagues in the room, please let's join them. And that is the, so we can have this started from the base, from the base. Then we have others at the back. All right, thank you, everyone. So we will be reconvening. We're breaking for tea now. Tea is served just at the lobby outside. But please, we'll be reconvening by 1:45 p.m. 1:45 p.m. We shall be reconvening in the hall. Please, let's put that in the back of our mind. 1:45 p.m. We shall be reconvening in the hall to commence and continue the proceedings. Thank you very much, everyone. In distinguished colleagues outside to please let's make our ways back into the venue so we could commence proceedings. If there are other colleagues who are outside that you have access to, if you don't mind, you could also send a message to them that we are starting. And it will be helpful if we have everyone seated as we continue proceedings. So, as we earlier announced, we will be combining this next section. Not that we're going to have everybody, but we will only take the Q&A when we are done with the presentations. Still waiting for other colleagues who are outside to please make their way into the hall. I will be confirming that we have the panelists for this next section already in the hall. So for the next two panel sections, we'll be having for laboratory and the workforce. And for the laboratory section, the moderator will be Dr. Farah. I just want to recognize that I can see Dr. Farah, she's there. And we will be having Dr. Clement Meseko of Philip Ayuba. Okay, thank you, Dr. Clement. It's good to have you. Dr. Agogo Gweshere is from the Federal Ministry of Environment. Can I confirm? Great, thank you, sir. Then from the Nigeria Center for Disease Control, the Director of Laboratory Services, Mrs. Babatunde. So it's good to have you. Thank you. So we're good for the laboratory team. For the workforce panel section, we will be having, as moderator, Dr. Ayode. I'm not sure I've seen Dr. Majeko to me today. Dr. Zira will be, okay, great. Thank you, Dr. May. All right, so Dr. Zira will be anchoring that section. And we have for Nigeria Center for Disease Control, Dr. Fatima Saleh. I know I've seen Dr. Fatima earlier. Thank you, Director. Then from the Federal Ministry of Agriculture and Food Security, the one and only Dr. Azako. Thank you, Dr. Azako. It's always a pleasure. For Federal Ministry of Environment, who's representing Madam Rita on this? Is this Chika? You won't keep Chika, now only she good. Or both of you will do it. Anyway, all right. One of the ministries that I actually think workforce issue is really biting out is Ministry of Environment, for real. I see the way they try to shuttle different meetings, just a few of them. It's really very challenging. I'm sure this is going to be one of the benefits of this exercise, to see that we have the adequate workforce representation across the ministry. Okay, so since we have the panelists ready, I think it will be appropriate to take this further. Where's my colleague? He has abandoned me. Okay, please. Let's move this on to the next agenda. All right, so we will be calling forward for the laboratory section, speaking to the laboratory activities in this meeting. Please now let's formally make welcome to the podium to moderate the section on behalf of the United States Center for Disease Control and Prevention, Dr. Farah Hussein. A round of applause for Dr. Farah, please. One thing about applause is there's a way it makes the speakers more encouraged. Thank you. All right, then for the next panelist, we have Dr. Clement Meseko. Dr. Clement Meseko, a round of applause for him, please. Federal Minister of Environment, Dr. Agogo Gweshere. A round of applause for him. And from the National Reference Lab, Director of Lab. Okay, So this one is balanced, 50-50. Gender balanced. The other one was gender overbalance. All right, so Dr. Farah, the floor is yours.
Great, thank you. Good afternoon, everyone. So we got a brief overview of what was to be included in the lab section, and it was focusing on specimen referral and transport, testing capacity modalities, biosafety, biosecurity training, and veterinary lab diagnosis. So I guess the first question, and what we started with in the previous panel, was how you came about these activities. Why are these priorities? And what critical gaps are they addressing? So perhaps we'll start on my right with Dr. Clemens.
Good morning. So it's really nice that we always have this conversation going, and not minding the fact that the committee had been able to put some data together with respect on what our priorities are. And like was mentioned in the earlier panelist discussion, we would just need to prioritize. And it's very good also that we know this is a catalyst fund, and so that's we catalyze what are the activities we are going to be embarking on. And with respect to limited resources, that brings about having to prioritize what you need to do. And before you now kind of imagine the activities that you need to carry out, you want to first of all know what the gaps are. Apart from the gaps that we've identified through the international health security analysis, we also know that we've had experiences with pandemics in the past. At least in the last century, we also had another influenza, swine influenza. And in this millennia, we already have this experience with COVID-19. So in all of these, what were the gaps that we identified? I mean, we tried sometimes to kind of scrabble to see, that's with respect to response, because we didn't prepare sufficiently. And so if we identify that now as a gap, it makes going forward to be much better, and that's we will identify some of these activities along with this gap. And because we've had some experiences in the past, I speak about influenza, for instance, and some other persons had mentioned it. In 2006, we actually had an influenza kind of outbreak, avian influenza in this case, which will have been a pandemic. And now it is not off the table yet. The next pandemic, we talk about disease X. It could still be an influenza virus. But besides influenza, there are a lot of other infectious pathogens. However, if we will take lessons from our experience with influenza, it's really going to help us in identifying the gap and the activities that will help us in the preparedness. And I know there had been such success stories some years back, but the problem really is lack of sustainability, lack of sustainability. And so there are activities that we may now need to carry out with respect to being able to identify these gaps that will now help us to be better prepared. And so one of such activities that we with respect to how we are able to receive samples from across the nation. One thing I would like to say also is that you will not know until it is known. And what I mean by that is, we've talked about early detection, but the early detection will have to be confirmed by our capacity within the laboratory. So we are eventually going to be able to identify the pathogen is so very critical. But I like the way that each of the thematic area fits into the other. Because for us to also be able to build a certain capacity and a sustainable capacity in the laboratory, we then needs to be strengthened. That's when the workforce comes into it. So in short, the gaps now are with respect to sustainability and then application of modern technologies that will eventually help us in being able to make a confirmatory diagnosis early enough that can then trigger the early warning and early reporting. Thank you.
Thank you. Dr. Gogo, please.
Thank you very much. My name is Agogo Bisha. I'm not a doctor from Federal Ministry for Environment. With regard to transportation and referral issue, for Federal Ministry of Environment, for now we have just 2 labs, which is very limited. that has been assessed that fits into the activities of carrying out analysis, especially in the area of microbiological activities. And looking at the nation, Nigeria, we have 36 states. One of the labs is at Port Harcourt, the other one is in Kano. Presently, they don't do much with microbiological analysis, which through the JE and other events that have happened, they have introduced such things. So they don't have much capacity to do much of the analysis which we are talking about. They may be able to identify the organism, but may not be able to do further analysis. So such gaps in terms of doing proper research or proper analysis made us to choose this aspect in terms of taking sample either to the earth lab or from the field to this because of the gap of laboratory across the environment sector, either to work with the earth sector or the animal sector in terms of sample collection and transportation or referral. So that is a major gap in the environment sector, which we want to address, especially in the area of AMRO pathogens, which needs more analysis activities. So those are the summary of why we actually choose this aspect of activities to enable us take samples from the environment, analyze what we can do in the lab, and do further analysis in other labs that are necessary, and especially the period of maybe an outbreak and other activities. Thank you. Over.
So I would just want to start by reminding us of the JE that was conducted in 2017. And then at the end of that JE assessment, 4 priority areas were recommended for strengthening for laboratory system. And so they are quality management system implementation, establishment of laboratory network, establishment of sample referral network, and then laboratory testing capacity modalities. And so incidentally, 2 out of these priority areas that were recommended are also priority for this fund. So that is the reason why we are working on those 2 priority areas. So I will also want to talk about what we have done from 2017 to now. In 2017, before the assessment was conducted, I will limit the focus of this fund. And so the country had no organized system for sample referral. We relied largely on ad hoc means of sample transportation. You know, you can imagine people using public transport to move Lassa fever samples. So while trying to solve a problem, if care is not taken, we create more problems. And so the country has made some interventions. We were able to engage courier services, and so that we can have an organized way of moving our samples. That has addressed biosafety and biosecurity, challenge to engage courier services to move samples from the different states to the different testing laboratories across the country. So, and that is the major intervention that has increased access to laboratory diagnosis in the country. So currently we have 3PLs, courier services that are moving samples. We need to sustain the beautiful system that we have established. We need to continue to train laboratorians on sample packaging, collection packaging. We also need to procure sample collection materials and support states in the movement of samples, even from the state designated hubs to the different testing centers. So it is very important that this fund can be leveraged, to sustain that system that we have established, because the other funding will be ending soon. And so additionally, just like our DG said when he was making his presentation, that sustainability is for government to take ownership. But we also know that government funding sometimes can be, it's very important for us to be able to sustain the beautiful system that we have established. So I will also be talking about to strengthen laboratory testing modality. Like in prior 2017, the country had just, I think, 4 facilities with molecular testing capacity. And so you can see that that's a very big gap. But it's no gainsaying that COVID has enabled us to strengthen our laboratory system. And so as we speak, there's no country in Nigeria that does not have molecular testing capacity, especially for COVID. And so because the uptake for COVID testing is very low, most of these labs are there. And given the available equipment and platforms that we have procured with so much resources, there's need for us to leverage the existing capacity for integrated disease testing. Because that same capacity that is available in most of these labs can be leveraged. Although it was for COVID, we can also test some other diseases. And where integrated testing already exists, like at the regional reference lab, we are looking at also scaling up to multi-pathogen detection, because despite these capacities that exist with only monoplex means testing a particular pathogen at a time, which can be very time-consuming. You can imagine when we have suspected case of viral hemorrhagic fever, there's need for us to do differential testing, and so it's time-consuming. But when we have this multiplex access, we will be able to test a lot of pathogens using the same sample and within the same time period. So if we are able to leverage this fund, we'll be able to procure the necessary commodities. We'll be able to also support the laboratories in training on current and evolving laboratory techniques, and so we can be better prepared for the next pandemic. Yes, thank you.
Thank you. So before we open it up to questions, let me just take this opportunity to ask something. You had mentioned a little bit about AMR, and we know that that's a huge gap and priority for Nigeria. And so could you individually just speak a little bit about how the fund will address that from the lab aspect?
So there are a lot of pathogens, zoonoses and AMR. And so one interesting thing about the laboratory capacity is such that when you have capacity in one area, it can be leveraged to many other pathogens. I mean, she just spoke about multiplex pathogen detections, and then there are even instances where we need to use technologies that are a bit advanced. I mean, from our past experience before COVID and after COVID, we improve in our approach to diagnosis, but there are still some modern techniques, some modern technology that part of the strengthening of the laboratory capacity will enable. So with that is the multiplex and some rapid antigen detections or things that will kind of increase the turnaround. So with respect to AMR, antimicrobial resistance, so some bacteria, some viruses. So at the end of the day, when we use multiplex and we are able to make multiple detections that will also include AMR, so the same laboratory personnel that are trained, they will use the same approach in being able to kind of leverage on the ability to kind of make detection in AMR. And then when it even comes to genomic sequencing and ability to define which of these resistant pathogens becoming an issue. There are instances where even for viral infections also, there are some antiviral medications and drugs that are used, and some of them also over time develop antimicrobial resistance. And so it's to be able to identify markers for resistance. So all put together, the strengthening of the capacity in the laboratory will be leveraged on many other pathogens, including antimicrobial resistance pathogens. Thank you.
Okay, so let's go on with a few questions.
I want to thank the discussants for the enlightenment. My concern is this. Just like you, right? I'm Professor Rosemary Aldo from Nigerian Institute of Medical Research. You know, you talked about the multiplexing so that you can detect several pathogens at a time. Okay. I guess you are talking about the human samples. You know, we're using the One Health approach. And then we also have labs for animal testing, veterinary labs. Are we also thinking of where we can also capacity development, where you can do all of this, both the human and the animal, in one place, such that we can also do some good linking because if you're collecting samples from a particular region, human samples, and you're getting samples from animals from the same region, you can relate them together. Is there anything that is being considered in that direction? Thank you.
Is it Dr. Fatima? No. I'm going to let you, go ahead, you're watching.
Thank you for the presentation. My name is Patrick Nguku with Afinet. So I really like those 4 priorities, and I believe they are based on some evidence. So I just wanted to ask for priority number 1. There is a good assessment that FIND, Afinet, and NCDC did on diagnostic network optimization on Lassa fever and yellow fever. Just to think about, based on surveillance data, what are the opportunities to optimize that would reduce the turnaround time for testing and transport for most at-risk population? And the study, the assessment was just completed a few weeks ago, and I think we had a very good discussion on some of the opportunities to optimize. So if there are opportunities to just relook at some of the specific recommendations in terms of Lassa fever, there were suggestions on what would be best in terms of sample collection hubs for at most risk population, in terms of labs that are not utilized, in terms of collection centers that are not optimal. So if there are opportunities to look at this sort of evidence-based.
For such a great job that you are doing, and in coming up with the items that you intend to work on in the surveillance systems. One thing I noticed that is missing, or probably embedded in one of your items that are listed, is that you already do a great job collecting samples, analyzing samples, managing the results and transmitting to make sure that they get to the end users timely, so that diseases are identified and the mitigation steps are taken immediately. But I have not heard anything about how do you get rid of all these samples? How do you dispose of the samples that you have collected and tested, both in the clinical settings and in the environment? I noticed that, by the way, my name is Professor Babatunde Green. I forgot to mention that. I'm an executive director of as how we that are involved in doing all of this, because all our centers, we get rid of them so that they don't add to the problem of polluting our environment and spreading diseases, samples. I would recommend that that be included. Thank you.
Yes. Thank you very much, the MR focal person. So I just want to also respond to what the lady over there mentioned about an integrated surveillance. We are piloting a tricycle project in the country in Osun State, which involves actually collecting samples from the same area of humans, animals, and the environment. So with the hope that we use the outcome to establish a national integrated AMR surveillance system. So this is just to respond to the lady. I want to write on Dr. Loi's submission on the need to involve facility in surveillance. So I will want us to understand that for AMR surveillance, it's actually facility-based. So this is the time for the pandemic fund team to look into strengthening the laboratories at the healthcare facilities to be able to detect AMR at the facilities for the patient care. When you talk about genomic surveillance, you are doing retrospective, detection of an outbreak that might have cost, patients' lives at the hospital. So I think there is need for us to either paraphrase or rephrase the objective on the lab to say that strengthening laboratory and antimicrobial laboratory AMR surveillance, because AMR surveillance is facility-based as it is in the country. And I'm just reading a publication on PubMed that the future pandemic is actually not likely to be a viral infection. They are looking at a bacterial, infection as the next pandemic, the future pandemic. So I believe if we're applying for any pandemic fund, we should consider, AMR, because it is said that bacterial infection, and not only bacterial infection, antibiotic-resistant bacterial infection is the future pandemic. So if we are applying for any pandemic fund, we should bring AMR to the fore. It should be clearly stated that our priority as a country is actually antimicrobial resistance. And I will want to conclude by this, that currently in the country, for us to see the need for us to prioritize AMR in this application is that we only have designated reference lab and designated sentinel labs in the animal health sector. But from 2019, since when the Fleming Fund started, there has not been any surveillance activity in the animal health sector. So we only have designated labs all this while. So we need to prioritize. In the environment, we only have designated reference labs, 2, one in Port Harcourt and one in Kano. We don't have sentinel site. So these are some of the things that I think we should actually put into consideration for us to be able to clearly state that AMR is actually a priority for the country. So I think, let me just stop. And another point is that the last JEE, if we're looking at priority, if we're applying, for this kind of fund, what they will look at, because the JEE has been published, the JEE report has been published, and AMR scored 2/5. So why are we not prioritizing AMR based on the JEE report? Thank you.
Thank you for those questions. So let's start with the first one, and I think it was partially addressed about the linkages to develop capacity for both animal and human health. So part of that was answered by our last speaker, but I just wanted to ask the panelists if they have anything to add to that.
So for question one, with respect to the one-head approach to laboratory diagnosis, we have started. What we now need to do is to strengthen it. That's why the strengthening kept reoccurring, strengthening our capacity to do more. Interestingly, pathogens, like we know, and that's why we call them zoonoses, or some pathogens that needs to be approached through the one-head kind of glass. Rabies in human is not different from the rabies in animals. The virus is the same, and almost all other pathogens, and that's why we come up with the idea of 75% of this. If you have 75% of pathogens that are common to man and human, that's like taking majority. So it will be good in kind of a specific, deliberate, like you have raised, where we will now see that some of the capacity we bring up in the laboratory are able to address either way. So maybe there could be some ethical kind of switching of ideas, because by laboratory practice, really, until recently, you are not supposed to handle specimens from animals and also handle specimens from human in the same laboratory. Maybe, for instance, for influenza, why that is suggested is that you don't now cause a transmission, between, or, a human pathogen, for instance, if the laboratory personnel do not approach through some quality system, they could easily be infected in the diagnosis of SARS-CoV-2. in the early time. And so I know we are also applying that to other pathogens. For instance, I know rabies, for instance. I mean, there are specific scenarios where when there's a rabies in human, the specimen could be collected and the diagnosis made in a veterinary lab. And in most universities with the Faculty of Veterinary Medicine, there's a department that is dedicated to what they call veterinary public health. And it means that there are pathogens in human, there are diseases in human that can be handled by those departments. So I think we've really started. But what we then need to do is to strengthen what we have started so that with the multiplex, for instance, if we use a multiplex technology and we're able to detect maybe like 10 pathogens at once, some of these pathogens may be primarily from animal sources, some may be from human sources, but a single assay is able to tell us that. And I think that's a very good way to approach. That would be part of our pandemic preparedness, because early detection within those assays is able to signal what next step needs to be done to prevent such pathogen from causing a pandemic. That's on question one. Thank you.
Thanks. Any additions?
Yes, I just want to add to what Dr. Mesiko has said. Sometimes, like as we have in the country, we don't have, yes, we leverage on COVID, but it's also important for us to know that the biosafety requirements for handling animal sample and human sample are not the same. So no animal sample can be handled in a BSL-2 lab. And so presently, most of our labs are BSL-2 lab. And then the VOM, for now, is the only lab in Nigeria, I think, that has that BSL-3 facility. So recently, when we had that anthrax scare, yes, we collaborated with VOM. So collaboration is very important. In the case when it is not possible for a lab to handle both human and animal sample, I think it's very important for us to collaborate. So what is important, and that's why we are looking at this One Health approach. Those samples that we cannot handle in human lab can be handled in animal lab, and that's what we have been doing. Thank you. That's just the addition. Biosafety level requirements are not the same for the two. Yes.
Okay.
I also want to talk about the waste management. Yes, this is very key because you know that waste can be used as biological weapon. So for biosecurity, biosafety is very key, that all these measures are in place. So if I may give an example of what we do in NCDC, yes, we have different levels of labs in our network. And so we have a checklist, to assess any lab to be activated for a particular disease. And so waste management is very key. We don't activate any lab that does not have an efficient system of managing waste, because we are really conscious of the biosafety and biosecurity aspect of the work that we do. So this is very key, especially when we implement quality management system, because that is the only way by which our results can be reliable and reproducible. So, and biosafety, biosecurity, waste management, all these are important areas that we look at and ensure that authorized access to this waste. Because it is not only when you have access to those organisms, waste most times can pose a very big threat to the environment and at large. So it's very key that waste is well managed. And like I said, once a facility does not have a proper system for waste management, that facility can never be optimized for testing of any of our priority pathogens. Yes, thank you.
So I like to actually emphasize that is captured in laboratory activity 4. Implement joint risk assessment and capacity building programs on biosafety and biosecurity. So embedded in biosafety and biosecurity is waste management. I mean, right from the point where the sample is collected, there are protocols that will ensure safety, infection prevention and control, and then biosecurity. And so, for instance, if there's an outbreak of an animal disease, even influenza, for instance, there's a protocol by which the farm may be depopulated. The animals are kind of humanely killed and buried according to protocol. So that way, the infection is contained in the farm. And then the risk of transmission to the next farm and to even the handlers, the human, is limited. To the next farm and to even the handlers, the human, is limited. And then if this sample, through proper protocol, is eventually transported to the laboratory, I'm sure there are a lot of times when samples are rejected. And so we don't even test some sample based on certain criteria. And eventually, it is not the whole sample that arrives in the laboratory that is a kind of a candidate for testing. It's just a portion of that sample that will be tested. And so there's also a protocol that will say what happens to the rest of the sample, how long do you have to keep a sample in the lab. At the end of the expiration time, these samples, by protocol, also are destroyed. I would like to use the word destroyed, because sometimes we want to reflect to the origin of SARS-CoV-2. I mean, there's still these two opinions out there, that is this a virus that emerged in nature, or is it a pathogen that escaped from the laboratory? I would rather say it's emerged in nature, you know. So, but if we don't manage those samples well, there's a risk that it can escape from the laboratory. So we take it very seriously. And that is why some samples cannot be handled except in a BSL-2. And some cannot even be handled in a BSL-2, but in a BSL-3. Thank God at least we have a BSL-3 that with funding can be better managed in terms of maintenance and sustainability. And I cited somebody from Plateau State, maybe the epidemiologist from Plateau State. So I like to relate with him with respect to how we collaborate with respect to One Health. Most of the waste that are generated in Jude, for instance, in most of the hospitals in Jude, they end up in the National Veterinary Research Institute, because we have a capacity for incineration. So either by chemical means, by some liquid means, there are all these protocols to ensure that samples are contained and are not allowed to escape from the laboratory. So there are protocols for managing that, and that is embedded in activity number 4. Thank you.
I just want to comment on the waste management aspect, the hazardous waste. Yes, what my colleagues have said, yes, in the facility it may be true, but in reality, what we experience in Nigeria, the waste gets to the communities, and we have hand pickers here and there. But of recent, like what the DG has said and other people have said in this meeting, this fund is not to cover all the aspects. But I just want to bring to our information that of recent, the National Waste Management, Healthcare Waste Management Policy was reviewed and validated last month, which major stakeholders participated. Also, implementation plan 2 costing was done last month. And that very project is being supported by, I think, Global Fund in that respect. And I think it will go to the next level of implementation, because really everyone have to be on board, not until pandemic comes or this thing, because the reality of healthcare waste management practice in Nigeria, we all need to be on board. So that policy and implementation, which we expect to commence with those funds and everything, we help the system, whether there's pandemic or no pandemic, once we all work together and make it work. So that is the information I have concerning that. Thank you very much.
Thank you. So the next question was about opportunities to optimize current assessments that have been done to reduce turnaround time for most at-risk populations, and this was done recently for Lassa fever. So looking at labs and collection centers that are not fully optimal, functional, or utilized, has that been incorporated?
Okay, so that comment is noted. We are also aware that for us to have a very efficient laboratory network, it must be evidence-based. And so what we have done before now, was just based on sometimes geopolitical representation. Oh, you have it in Southwest, you don't have it in Northeast. Why? We all understand our country. So we know that going forward, a laboratory is supposed to be established based on data. We look at the available equipment platform, we look at the human resource, we also look at disease burden, because we know that we have that spread across the country. So for instance, if we have to set up a lab for Lassa, we know where to set those labs in the country. So that is noted, and going forward, we would implement the findings of that assessment. Yes, thank you.
And then the last comment, it was more of a comment than a question, but just focusing on AMR and the consideration to really focus on strengthening health facility labs and to sort of put that into the title of what we're trying to do. So I don't know if there's any response to that, but that's a comment that's well noted.
Yeah, so it's a noted comment, and that is why in activity 2, we say strengthen laboratory multi-pathogen. So this multi-pathogen also include bacteria. And so I'm primarily a virologist. So if you ask me what disease is going to be responsible for the next pandemic, I would say it's going to be a virus. So, but nevertheless, we are kind of opening the umbrella as wide as possible to capture all pathogens. I mean, one good thing I will take away from that comment really is our capacity to, that will also enhance our turnaround time, ability to make detection at the point of occurrence. So in the hospitals, for instance, where we have facilities for bedside testing or pen-side testing, and we're able to kind of trigger the alert and now extend and escalate it. It's something we will have to work out. And that actually may be embedded within the multi-pathogen, and technology, application of technologies to some of this detection. There are a lot of equipment, modern equipment now that actually can solve that. And I think this fund will help us to leverage on that. Thank you.
Okay. I want to thank our panelists for their time and their responses.
Please give them another round of applause, please. Please just hold on for group photos, Dr.
So while they are taking the photograph, I'm not sure if I picked the comments relating to issues of having the national biorepository capacity. I wouldn't know what our thought would be. This is just on the site. Then the conversation around the national sample transfer policy, I'm not talking about MTAs now. Is there a need to have a policy as a country on our transfer agreement, so to say, for samples leaving the country, speaking to the issue of biosecurity concerns that was earlier raised. But much more importantly, the issue of biorepository capacity. I know Lagos has something that is really doing very well. I don't know, for us as a whole country, is there a need to look at having a policy in this regard of having a national biorepository capacity for us as a country? I wouldn't know what the thoughts will be later on. Apologies, I'm bringing it at the end because I didn't have the time. Are we through with the photographs? I'm just doing that while the photograph is going on. We're done? So thank you very much. A round of applause for the theme. I know my thoughts will be considered later on. Over to you. Okay, so why you bring it up?
So we just bring up the next panelist. And I'll just bring up the moderator for the next panel, focusing on workforce. Dr. Zira, are you from FAO? Please a round of applause for him as he comes up. We also have Dr. Fatima Saleh, NCDC. A round of applause for her, please. Dr. Samuel Azaku, Ministry of Agric, Federal Ministry of Agric. A round of applause for him. And we're welcoming back Dr. Chika Okpala from Ministry of Environment. A round of applause for her. She's a two-time panelist. You can give her another round of applause again. Over to you, sir.
Thank you for saving the best for the last. So we are here for the discussion on workforce development, and we know that the need for capacity in terms of number and in terms of knowledge cannot be overemphasized. And workforce is key to achieving everything else in any other technical area. So can you briefly tell us more on the gaps, the prioritized activities would want to address, and how you came about prioritizing these activities? We start with you, Dr. Fatima.
Thank you very much for that question. And good afternoon, DG, and good afternoon, everyone. My name is Fatima Saleh. I work with NCDC. So, as you've mentioned, what actually led to prioritizing those activities, of course, is basically our IHR, which has always been our benchmark. And to even start with, we all know that for you to have a strong care delivery system, health security systems, you need to have competent health security workforce to drive this. So in line with the IHR recommendation of having the requisite human resource to implement the IHR in terms of detection, prevention, and response, as a country, we prioritize training of our health security workforce, training and retraining. Reasons being that we are all aware of the recent migration issues around the health workforce nationally. So this is the right time to really see how we could sustain some of the health security workforce training that we've been doing as a country. I would cite an example of FETP that we all know. That's the Nigerian Field Epidemiology and Laboratory Training Program across the all tiers, the frontline, intermediate, and the advanced. We can all attest to the role these key, these epidemiologists have played in the past. Ebola is something we can all resonate with. Currently, we're also battling with some of these infectious diseases, and we know how epidemiologists across board have been very in the forefront of controlling this. We knew also how the polio eradication, you can't finish those stories without the field epidemiologists. So we felt as a country, this is a huge resource. We have to sustain training them to account for the attritions we're experiencing. And also for us to, of importance again, incorporate the community component of it. I mean, the basic One Health curriculum for the all tiers of the field epidemiology, because, as we said, when you train this, you account for attrition and you prepare these people to really fill the gap in the event you have further attrition, and they are really equipped to be able to actually do the work they are meant to be. So, in a nutshell, we'll prioritize this because of the key antecedents and the importance this workforce play in our health security architecture. We also prioritize, because part of sustaining the training is also doing it well. And we are all saying, okay, let's all come together and pool and really ensure that those sectors that are not doing well are really mobilized to be at par with the human sector. I'm citing the example of the environment sector now. So part of what we're desiring to do is to ensure that the environment is, also in the front burner. We all we acknowledge the fact that we need to improve in the trainings, and we felt they need to review the environmental component of the field epidemiology training is very important if we're really going to do this One Health approach. So across both the community, the subnational, and even the national level, talking about the frontline, the intermediate, and the advanced, we felt that it's really need to review this curriculum to bring this environmental sector colleagues at par with what we do. So again, issues around sustaining this training has also to do with having a career pathway for the field epidemiologists. We are also desiring to see how conversations can happen to really bring all key relevant stakeholders to begin to see how do we incorporate field epidemiology in the scheme of service, both at the federal and the state level, because we believe this could serve as an enabler, as part of the retention initiatives the country is trying to put up in place, aside the other high-level policy issues on migration policy, which it's also coming on board very soon, as a nation situational analysis has happened around what are those things that can be incorporated in the national migration policy to address some of these things that could see how we could mitigate these issues of healthcare worker migration. So I may not have said all, but I feel these are the reasons that we felt, yeah, we should prioritize this as a nation. Thank you. Over for now.
Thank you very much. Dr. Anzaku, if we could hear some gaps, especially within the animal health sector, and how these activities can address such gaps. Thank you.
Thank you very much, colleagues. I think she has said a lot as far as the issue of the workforce, but just to also reiterate the fact that the issue of workforce development is also a critical gap that was identified during the PVS. That's the performance of veterinary services that was done. The last was done in 2019. Some of the problems we have in the country actually predates this administration. The issue of sometimes engagement of more veterinarians and para-veterinary professionals in government services, especially at the federal level. And like she said, because of these obvious gaps in the workforce, that is not enough. Looking at a country like Nigeria, it means you are focusing on just the higher level. And that is why the ministry, with the support of FAO, for instance, in the animal health sector, deliberately started the program, or the e-survey training program. It's a shorter time program. And I think, if I'm not mistaken, we have trained about 150. And the idea is for them to do what? The issue of data collection, detection, and co. You will all capacity building program, you have a problem in terms of coordination and in terms of reporting of diseases. So this program that we're talking about, workforce, is to look at the private sector, bring them on board as part of the people that are engaged in service delivery and reporting of diseases of any kind. We've been doing that, and again, we've now also realized that there's still a gap. Having those at the Isabel trained is not enough. And that is why the ministry, in consultation and in collaboration with the Veterinary Council of Nigeria, deliberately talked about the issue of this community animal health worker scheme, which is almost synonymous to what we talked about, this community animal health, community health assistance in the human sector. So Nigeria is a very big country. And honestly, if we really want to make an impact, they need to train these people at the grassroots, cannot be overemphasized. We also deliberately think that maybe even as part of this program being done, we need to actually take a look at ministries, veterinarians, and para-veterinarians for some time. And what we're trying to do is to, look, can we have a sanitary mandate scheme? Because I'm sure all of us, the veterinary practice is not in the cities like Abuja or the big towns. It's in the hinterlands. That is where disease, and this is where the animals, bulk of the animals are raised. So we are thinking that we can leverage on some of this private sector through a sanitary mandate program. Here we strengthen their participation in this service delivery, and by the time they deliver on these services, they will be able to give us reports because they are the first line of contact with these animal owners. Basically, I think this is what we are trying to do, and there are key gaps, and we believe that if properly incorporated in this document, it will stand the test of time because it's going to be a win-win situation. Like I said, over 80% of the veterinary workforce is in the private hands. But we must harness these private hands for the betterment of this country. Thank you.
Thank you very much. Mrs. Chika, let's hear from the environmental sector. Thank you.
Good afternoon, once again. Environment. Two of us are trying to reshuffle between the panelists. Coming down the stage after my first talk, somebody met me and was asking me, do you really mean that you have environmental health officers in the local governments? Yes, every ward, every community has an environmental health officers allocated to them. But because they are limited, because they don't have enough manforce, it seems as if they are not working. So they're very, very key and very important that we try to include the government needs experts in trying to improve in employment of environmental health officers. Aside from there, we also need to do more in terms of training of them. We are trying to establish more, not establish, to improve more in these trainings for a long time. These are things that I've been doing in paper-based, but seeing it now digitalized, making their workforce very easy for them. It has been a very, very, very important thing. So the environment angle, the workforce need to improve very well. Then also, that of the environmental health officers, we don't have, only people don't have enough capacity, enough funding for them to go to their local areas to do their routine sanitary inspections. These are things they're supposed to do all the time and every time. Now, for them to report this until when they go out and have this documented, but because there is no encouragement, because there is no promotion in any aspect, you find it a little bit difficult. Thank you.
Thank you. Very great deal of issues when it comes to the JAPA syndrome. Like, you have a lot of people immigrating. And even while we talk about training and retraining, we would like to know what approaches can be put in place to ensure sustainability, even as you are training and retraining people. And then there's the whole immigration that is going on. What approaches can we put in place to ensure that there is that sustainability within the system? Let's start with you, Mrs. Chika. Thank you.
Okay, thank you very much. I think that's one of the things we are actually suffering from now. But I think when we improve our career development, these people that are working, how far are they moving in their career development? And also improving their workforce, improving their work conditions, because it's very key. You can look at it that majority of JAPAs, of course, you have old people, but majority of them are young ones. How far are we being monitored and mentored as they're coming into the environment, they're coming into the system? And do they have support that is encouraging them? Do they have mentors that are encouraging them? And also, as I said, their working conditions, where you need a laptop to work, where you need an internet to work, where you need a light to work, all these things are insufficient. They are not even available. So I think when you have this, it encourages them. And then training is very, even though we have said that, training and keep retraining. There is also this compensation, incentive that helps. I will use a story of when I served in NAFDAC. Immediately after my youth service, the day of my service, the last day of my service, that was when the Oracle of Blessed Memory was there. I know she did so much well when it comes to staff welfare. She sent a parcel from Abuja down to Ibadan. I served in Ibadan. And that was so much an encouragement. I know how far I tried to see if I would work in NAFDAC because I saw the encouragement that comes from the DG that doesn't know me. So there is also, we need to also encourage the staff that are working. How do we try to promote them? How do we try to recognize them? I think these are very key. Thank you.
Dr. Azaku, please.
Yeah, the JAPA, I want to say with due sense of responsibility is more, we want to say more in the animal health sector, especially when you talk about the government or public service. As a matter of fact, I think one of the major problems we've had, like I said, there are problems that actually preceded this administration. The issue of employment. You know, we don't have this issue of even employment to even sustain the system. And I want to say, in some states, you can see that we have just 1 or 2 veterinarians, public vets, in those states. How do we expect such people to coordinate the entire activities of animal health care service delivery in those states? So I think one of the things that we need to do is for a deliberate policy of government of trying to replace some of us who have spent over 30 years. We will definitely have to leave. And by the time you don't employ people to join the service and the issue of the mentoring comes in, then there's going to be a very big problem. So we need to really, beyond the trainings that we're talking about, those who are in the system, the issue of engagement of public veterinarians and paraveterinary professionals in the service
so they also understudy the system, see what is happening. Because there are a lot of policy issues that need continuity. And once we don't do that, believe you me, whatever measures we're doing are just stopgap measures. So for sustainability, I think one of the key things that we need to do as a country is to ensure that continuous engagement beyond the private sector, animal healthcare delivery service providers, public, both at the federal and the state levels. Then secondly, I also want to agree with you, the issue of remunerations and welfare. Well, we believe that the new performance, the PMS that has been developed by government will stand the test of time and give us the required, because that is supposed to be merit-based. It has all its incentives, but beyond that, we need the issue of value reorientation among even our workforce. For us to be able to do whatever we're doing, we need to ensure that it is performance-driven and we achieve result. Finally, on this same aspect, I think, moderator, like you rightly said, and it was said earlier, we need the issue of what? Synergy and collaboration. I think is the key. We will continue to have problems about workforce in our different sectors. But I think one of the keys that we can do is to leverage on our strength in different sectors and collaborate meaningfully, deliberately for the fact that we're a country, whatever happens to one affects all of us. Thank you very much.
Thank you very much. And last but not the least, Dr. Ofaki.
Thank you once again. So for me, they've mentioned some other aspects that I feel they are very important. But just so to say, we also need as a country, because we are talking of migration policy. The Federal Ministry of Health and Social Welfare is championing that, and very soon that should be launched. And in that policy, because stakeholders have been brought to really brainstorm on that policy development, and a lot of issues have also been mentioned around our health diplomacy and international cooperation in terms of healthcare worker migration. How do we also, as a policy, see how we can, implement some of those things they've mentioned around incentives, around welfare, around deliberate and institutionalizing our professional development, and also these issues of career paths. And also, how do we also, as a country, leverage on some of these WHO guidelines on this ethical recruitment of healthcare workers? So it has a lot of dimension. We could look at it from policy level, from also regulations and guidelines on recruitment of healthcare workers, so that as a country we can even gain from the migration that we are experiencing. How do we harness this thing to actually be of benefit to us as a country? So they've, as I've mentioned, they've touched on so many aspects around welfare, reward, incentives, and all of that. Especially also, it's very critical that we are deliberate about it, because there's one thing having a policy or a regulation, but enforcing it. So I think from the body language of the ministry this time around, because it's a very key issue. So I think a lot of concerns are really raised around healthcare migration. And I think by the time that policy document is out, is launched, we're all aware of about it. We could key in to those activities in those documents. I wanted to, to mention something around the benchmark we are really desiring to beat in expanding the numbers of our health security workforce that we are seeing. We are also trying to ensure that we leverage on what we have as strengths. We have a lot of strengths in the system. So it's not about the gaps, all the gaps, but leveraging on the strengths that we all have. As a country, Dr. Anzaku and Chika can attest that as a country, we have a multi-sectoral public health security workforce strategy. So if we really implement that strategy, definitely I think that benchmark of having the requisite numbers of health security workforce per populations as is being projected for different cadres of health security workforce, definitely we are going to meet that. Because currently we are nowhere to really get into that benchmark. For the all tiers of field epidemiologists, we don't have, because we are desired to have 1 per 200 population, and as we speak, we've not achieved up to half of what we are supposed to achieve. And for the general healthcare patient doctor ratio that we also said, 1 to 600 population, 1 doctor to 600 population. And here as a country, from the last HRH policy document that has been launched, we saw where we are as a country. We only have 1 per almost 4 dimension because it's also involves issues around legislation, regulations, guidelines, and some of these technical and organizational issues we have mentioned here. Thank you.
Thank you very much for all your inputs. We'll open it to the audience for questions, comments. So because of time, we would have to limit.
I think you were right when you said we saved the best for last. Yeah. We literally have half of the room raising up their hands. So we have to do this in a very systematic manner. Maybe we would, I'm trying to see, maybe like 3 from each row, 2 from each row. Now the problem would be, how do we prioritize which 2? Okay, maybe we start from here. Please come over to the front.
The DG, I stand on all existing protocol. I'm Dr. Niro Ikomola, representing the Honorable Commissioner for Health, I'm Department Secretary, Ministry of Health, Ondo State. I think I've listened to all. In the thematic area, it's like we were so specific about training of community, health professionals and community health workers. And if we are talking response, we are not only limiting it to just the planning at the national, we want to look at how we implement it at the state and at the federal. And if we look at the structure of health delivery at the state level, we have the primary, which is at the local government level. We have the secondary facilities, the general hospitals, the specialist hospitals, and detection of any disease before notification, as earlier mentioned, comes from the health facility early and be able to notify as appropriate. We must extend our trainings and retrainings to the local government health workers, as well as the secondary health workers, and beyond that, to the private health. To the state, when it comes to the state, we don't involve the secondary facilities at all. It's like they are not existing. We jump to the local. Thank you. God bless.
Good afternoon. I stand with the established protocol. A few comments. I'm from UN Migration Agency, IOM. So I'm very delighted the comments came from the panel members that migration policy is coming in. And we work also from my agency. We are a kind of multi-sectoral agency and deals with not only out migration, also the internal migration in the country, and that happens due to various dimensions. One of them is we had a meeting very recently on out-migration of health workforce, and this is very critical to address for the country, and it is similar in many other countries in the developing nation. And we cannot prevent it, but how we can address the issue in thinking and innovative way, that is should be one of the approach. At the same time, the migration is happening in the different forms, like we have IDP settlements, whether I know that in some places that the health facility allocation is coming up based on the regular population. We do not consider that how many extra population are there, how many are moving out, so how we can address. And I also cognizant that this pandemic fund proposal will not address every other aspects of these issues. But one of the things that I want to highlight, we have training. We did not consider POE issues in this application, but we have training and community involvement. And this could be a plan B of our very peripheral approach. At the implementation level, we need to train, but at the same time that there are multi-sectoral stakeholders at the border levels. As we are discussing, this is a pandemic fund, will address the pandemic issues. So whether there is an importance or that there is a urgency to involve the border police and all those sectors to train them to work for the transmission, disease transmission, to prevent the disease transmission, and train them to respond when there is a need for response. Thank you.
Thank you very much. Okay, go.
I guess I get veto power. I have a mic. Good afternoon, ladies and gentlemen. My name is Dr. Aisha Abubakar Sadiq. I'm a permanent secretary, Ministry of Health, Kaduna State. I have 3 comments. One is strengthening opportunity for epidemiologists within the state civil service. Ladies and gentlemen, we have to be proactive, and we also have to think out of the box for that. Kaduna State has a lot of graduates that are FELTIP graduates of the advanced training program. I'm one of them. I left this country, I had about 4 of them working within the health sector. I returned and I had lost 3 of them. And I asked them what happened, and they all admitted they were put in the wrong places, they were underutilized, they were unsupported, and they were sabotaged. And I took it as a personal endeavor. I insisted they had to get back to the right places. We have to work on communication and advocacy with the policymakers. The wrong people are taking the information to our leaders. Being a trained epidemiologist is have somebody with no health training, no emergency response training, no training in data management, being a state epidemiologist. I approached the leadership directly, and I insisted by arguing about their expertise and demanded they be brought back. Right now in Kaduna, the state epidemiologist is a FELTIP graduate. The incident manager is a FELTIP graduate. The medical director of the Infectious Disease Control Center is a FELTIP graduate. He was there during COVID and they tried to chase him out. And I refused to allow anybody do that. Sometimes you have to take the risk. People get angry at you, but you lobby. He's an infectious disease specialist and a FELTIP graduate. Who else is better suited to be in that facility? I mean, it's just logic. And we have him back there. So he's doing that. I was the director of public health when I returned. I'm a FELTIP graduate. Of course, they phased me out a permanent secretary against my will, but we thank God. But the person who is the director now is a mentee of mine. Somebody identified mentorship. The person I put there, I spent a year training. He has his postgraduate qualifications. He has a master's. He's working on his PhD. I trained him in my office using FELTIP documents and training materials. I taught him the same software I learned. So when I was leaving and handing over, it was simply just moving to my office. And he understands what we're doing. So we have to do more about being proactive. The policy people who go to lobby go for contracts. We can't always just let them do what they want to do. You have to stand up and make it clear that we need somebody who can do it there. Now, the second thing I wanted to talk about is surge capacity. We need a surge capacity for veterinarians, etc. In the Ministry of Health, Kaduna State, I've enforced people to do it literally. They started copying, now it's like a policy, it's unwritten. We have interns. You have people who finish their NYSC and come to the ministry and say, I want to attach myself somewhere. You have people with master's degrees who come back into the country and say, I want to learn. They want to learn, but we make it impossible for them to learn. You involve them in the trainings. I know the partners in Kaduna, WHO, UNICEF, they have never said no to me when I say I want to add somebody to the trainings. Somebody who can build their capacity and contribute positively to the health sector. So speak to your partners. Get them in the room. By the time somebody who has a master's degree from the United States or the United Kingdom or any country in Europe comes back and has a willingness to participate in the health sector, ladies and gentlemen, that's your surge capacity. You put them in the room. By the time 2-3 meetings, you have them entering your data, they know what to do. Because we know we can't afford to recruit everybody. One Health Strategic Plan, which is being printed. We've inaugurated a technical committee on One Health, and we've been able to get our experts in animal health. Incidentally, you look like my director from the Ministry of Agriculture, and you do the same thing. So they actually got the people from environment, the people from agriculture, and what they admitted is a dissatisfaction to being excluded. So once we got the committee up and they were able to be in the room, and they had an opportunity finally to speak, they have been delighted and been wonderful. They come to the Ministry of Health and we discuss participation in trainings. So ladies and gentlemen, even at community level, the training on rabies that is under agriculture, I had slots. And I put people in the health sector. When we have trainings on surveillance in the health sector, I call agriculture because we have open dialogue and mutual respect. So the idea of it's because we are not utilizing all these opportunities. I will finish by saying this. I was proud to say I was Nigerian during the COVID pandemic. I was on my PhD. I came here to collect samples and the world exploded. So I was locked down in the Federal Republic of Nigeria with everybody else. So I went back to work. Now, when they opened the airspace, I had to go and beg the French, using my residency card, to evacuate me as a French citizen on an Air France flight. But I got back to Europe and realized they were in chaos. And everybody kept on saying Africa, as they said, is going to explode. And I sat down with pride and said, my colleagues will not fail. I just might have to bury some of them. And someone said, why? I said, because I know who I work with. You are skilled, you are competent, you are committed. You are just handicapped by resources and the environment you function in. So I have no doubt that all they have to do is put in the right resources and you will make it. So the worst that will happen is some of you, I'm sorry to say this, might die trying to move a patient, but you will not sit back and let Africa implode. And that is what you did. So when the response got better, people went, oh, how did you do it? I said, we've had a lot of practice. Our epidemic curves overlap. It's never quiet. So COVID is just what? Another variable. It's not a new thing. So ladies and gentlemen, we can innovate and explore the opportunities we have to do better. We need to think outside the box and forget the traditional bureaucratic system that just limits us and just, provides an environment that fosters all this chaos. Thank you.
Thank you very much. I think that deserves a round of applause.
So, good afternoon, everyone, the DG and all the other people. My name is Abdurrahman Ahmad from Ministry of Health, Sokoto. My one is comment with respect to this grant application. I'm speaking as a field person. I was part and parcel of COVID-19 response as secretary to the COVID-19 task force of Sokoto State. Honestly, I'm happy to have this pandemic fund application going. I hope it will be successful and Nigeria will get the funds. But I just want to emphasize on what previous speaker says. That blanket approach to all the 36 states, it doesn't work. There is no two people that are exactly equal. This is what my honorable commissioner always say. So honestly, what may work in Sokoto may not work in Zamfara State, though they are neighbors. So it's very important that while doing the grant application, we give room as much as possible, no matter how we navigate, to allow the state to develop context-specific interventions and funding so as to be able to implement smoothly. So we get challenged a lot in implementing Redise project, which is World Bank intervention through NCDC, because it's generic to virtually all the states. It's template that you just populate. You can create your own activity. So I think learning from that, this pandemic fund, please, on behalf of the states, let's not have that approach when we get the funds. And two, in terms of one of the greatest problems we are having is honestly the human resource. I'm not talking of Japa syndrome, I'm not talking of the capacity. The little we have, we have attitudinal issues, which is not unconnected to the reward system. When I say reward system is the accountability system, which is the reward component and the stick component of it. So you may have a hard-working person, as PAMSEC, as Kaduna State said, but not recognize all what he's doing. That person may be there not because of Kobo and Naira, but the system will not recognize. And somebody may be doing nothing, and that is the one that the system will keep rewarding rather than punishing. So if we can have, I'm happy DG is here, I wish Honorable Minister is here. If as a country we can sit and said enough is enough. Now we have good human resource strategy where from the grassroots, because that is where the operation is taking place. For us in Sokoto, we are blessed with a lot of outbreaks. Hardly a year will pass. No, it's true. But what we do in the state is we try to personalize our interventions. What we do in Gudu local government will not be the same as what we do in Eastern local government. This is what we do, and that gives us smooth running of what we do, which I think is something that as a country, we should never compare Imo and Enugu State. We should allow each of them, because they have contextual issues, human resource challenges to cope with. So I'm emphasizing this because part of the capacity building we should be doing, we should not look at the co-competent component of it. We should look at interpersonal communication, one. We should look at how do we manipulate our human resource to have system thinking. We are in syndemic, as they call it now. You can have 3 or more outbreaks going on in the same state, which by way they may have a way of augmenting each other, making the case worse. So, but the respondent may have lukewarm attitude as to approach looking at it, this is my country, this is my state, this is my home. How can I make it better? But the person may just, I have the skills, but the system is not rewarding me enough, so to hell with whatever will happen. So we have to look at how we inculcate in the capacity building, how we have thinking that people will become nationalists, that they will put their community first before their personal aggrandizement. So this is honestly part of what I want to say. Lastly,
Thank you. You know, we have other people on the mic.
Let's
give people other people benefit of that. Thank you very much, because there are quite a number of persons. A round of applause for him, please.
Good afternoon. Okay.
My own is 30 seconds.
Good afternoon.
My own is 30 seconds.
Good afternoon, everybody. I won't take time. I want to speak to the field epidemiology program. In October last year, there was a conference in Togo by WAHO, and the West African region reviewed the curriculum for the field epidemiology program. And some of the issues, it's how do the workforce, how they work across the West African region, where you can be recognized from country to country. Secondly, how do we standardize the curriculum? And looking at the felt needs of the people, that a lot of emphasis was laid, especially by the Anglophone countries, on the advanced program. That's the one that is very lucrative, a lot of funding from partners and all that. The intermediates and the front line were not so patronized because they didn't come with any additional incentive. So WAHO recommended that we should have the three. The front line we now recommended should, by the way, NCDC was represented at the table. They were major stakeholders. We should have the basic, the intermediate, and the advanced. And for people who are interested, because we are talking about career pathway and progress. So for those at the front line of basic, it should not just be the classroom or the Ministry of Health training that it used to be. It doesn't have any other thing. It should be a certificate. At least if you do 3 months to 6 months, it should be a certificate. Then the intermediate is what we recommend as a postgraduate diploma, and the advanced is a master's. And that we should work with institutions, because in Nigeria now, only UI and Zaria, they are the two major institutions, but we can open it up. Work with as many universities as possible. Let the ministry collaborate so we can train more people. And then you can have a career path. Because when you're talking about field epidemic, now we are talking about DSNOs. These already have some level of competency, but they just stuck there. Nobody wants to do a job where you are stuck. You are not going anywhere. People are leaving sometimes because there's no career path for them.
1 minute, sir.
And so these are part of the recommendation. And we should bring in more from the agri sector, from the environment sector, towards just the lab component and the medical workers. We can leverage on this to open the field for this training. It's in training, upgrade it, open this field epidemiology training, let more people come and build their capacity. We have a lot of people that we can use. They're already out there. All we need to do is identify how to train them, bring in the partners, and definitely we can change the narrative. Thank you.
Thank you very much, sir.
Thank you very much. I was just going to be very brief. I'm Sekir Olanriwaj Badaro from NCDC. My point is this on the surge capacity provision. I mean, for us to be able to build up the surge capacity, we need to have a directory. At the national level, we need to have the right directory of all the workforce, the health workforce that is on the woman, animal, and environment. We also need to have it at the state level. We need to have it also at the local government level. We need to have this directory so that when there is any form of outbreak or anything that is beyond the capacity of those that are really in charge, we can easily source for this, the support from this surge. That's just my own contribution. Thank you.
Thank you very much, sir.
So I wasn't going to speak, but I decided that maybe if sorry, go ahead.
Sorry for cutting you short. After you will take one more comment, and I think that would be it for the sake of time. Thank you very much.
I think I'll yield my this thing to people. I can feed back straight to the secretariat. Let other people speak.
Sorry, good afternoon. I'm still Elsie Lori from SEPI. I just want to add, because I know the state epidemiologist to Ondo State mentioned it, but I want to stress it, that we also create a career pathway for the surveillance officers. You put for the epidemiologists, but we need to also include the disease surveillance officers. I'm using the Ogun State issue as an example, saying that they are working as ad hoc. It's not good enough. We should have a career pathway for the surveillance officers. Thank you.
Thank you, ma.
Okay. Thank you. I think the purpose of this pandemic fund is to support prevention,
detections, and response. Now we have so many training programs that is ongoing. Is it possible for us to find a strategies of merging them together so that we can have maybe two streams that combines all the training that we have on ground currently, so that we can use that opportunity to build the capacity of people that will support prevention, detections, and response. And I think that would be very good. Like the bulk of the workforce is within the private sectors. Can we find a strategies or an activity or interventions to address that? It may be in form of plans that help us to be able to deploy people from different sectors when there is any response. We should find a ways of bringing it home in form of interventions for us to be able to achieve the larger pictures. Thank you.
Very much. Afinet behind. Go on, ma. Okay.
Okay, thank you very much. Standing on existing protocol, and thank you to the panelists. My name is Winifred from Georgetown University. So just looking at the activities that were stated out on the slide earlier on, it seems it's skewed to, and there should be that consideration for environment and agric. I see something about career pathways for state epidemiologists. Do we have equivalents in agric and environment sector that career pathway can actually apply to? We're trying to retain as much as possible. Also looking at the ways in which there is a sort of imbalance in the retirement age and their leave in the system. How do we create that balance? How do we retain? Chika Bala rightly said most of the people who are jabbering are young people who should be in the system, and the workforce is depleted, is thinning out. How do we create a balance? Thinking of how we can be, we should look at stating some kind of standard of practice for professionals. So for instance, an environmental health officer, what will the person be doing? Somebody who's health technology and they graduate. Then what? How do we get them into, how do we conscript them into the system? In that way, we would help to build the lean and overworked workforce as the case may be. Then lastly, maybe leveraging on some training programs that are already existing. As for Georgetown University, in the last 8 months rather, we've held 2 fellowship programs. One on Lassa Fever Clinical Management Fellowship, for which we've been able to see some results in this present outbreak. And secondly, on Public Health Emergency Preparedness, Prevention and Recovery Fellowship Program, but this is on a larger scale, looking at the West African sub-region, with a mentorship bit attached to it, and which will pan out or end for the first cohort in December this year. How do we leverage on this to build capacity, to be able to address? Thank you very much.
Okay, thanks. Just sustain is the right place, and just looking at what sort of catalytic things can we do in workforce, then domestic funding sustains. One proposition would be, and I think Winfred has talked about it, standards, creating standards, qualities for some of these trainings. And then the other things, maybe specific metrics. If you're talking about FELTP, you're at 46%. Could you use this to push it to 50%, but look at underserved? So that's another thing. But then the final thing is this linkage between clinical care and public health, because usually it's an obstacle. How do we deal? And I think Winfred has also talked about it in the context of Lassa fever. In an outbreak situation, how do we search for scalable and safe clinical care at that point?
Or an addition to Dr. Benga's, the AVOC surge workforce in Nigeria.
it seems as if it has died down. But however, I know that some states are still doing it. I know that Jigawa State is doing it. Some states are still doing it. I know that Jigawa State is doing it. I think there are other states. And that brings me back to the Commissioner Pamseko of Kaduna State. You as a we are, because so, to an extent, we have a power, we have an authority to move things. I think then when it comes to, there's something trained, you want to be there because you know that you are getting something at the end of the month. Not, so we really need to work to that extent. We have many things to say, but let me leave to other of my colleagues. Thank you.
Thank you very much.
Log on to that app and it will tell you, it will bring out my details. We also have the veterinary seal. This has been launched and there are ongoing efforts to really make people access reputable veterinarians who can give them services. And like somebody said, the quacks are in all professions. I think I can say that confidently. But again, we should be able to reduce quackery to the barest minimum. But what we do and how we access our clients and we give them services. Let me stop there. I have so many things, but I think we can share offline. Thank you, sir.
Thank you very much, Dr. Nzaku. Dr. Fatima.
So it's been mentioned that most of these things are comments, really, and they are well taken, and we are going to use some of them to inform coming up with some other revisions to this. But we had a writing workshop where all stakeholders came together to agree on some of these things. But again, there is always room to improve on these things. So for me, some key takeaways, it's what has been mentioned around. We all have responsibility in our own spheres of control to do what we can to improve on the system. Most importantly, I saw how mentorship here and even succession initiative, just like what PAMSEC Kaduna State has mentioned. She was able to do that because she has the power to do that. And that's, to me, how we should all, think and contribute to the health security in this country. We all do our individual bits, and you see that collectively, this could really trickle down, and overall, we have strengthening of the health system. Another key thing, though, it's not within the purview of this submission of this draft, but we've repeatedly mentioned the fact that these silo trainings that target same audience, Benga, I put it back to you. It's an internal matter. It's something I'm happy it's coming here. How do we streamline all this firm? Now, Winifred is saying they have a regional version of that same firm that they were part of initiating and implementing the earlier cohorts of firm. Now there is another regional perspective to this. So how do we pool resources together and do some of these things that can be streamlined? Keeping in mind that definitely we still have some sector specifics to really increase the numbers that we desire to really have, to really get to the benchmark set for the IHR and other benchmark. So it's all of us throwing this back to all of us, and I think this is, we can take this outside this conversation to really, now that we're all saying it repeatedly, all of us are chorusing it, to really streamline some of these things. But most importantly, integration of health facilities into this plan. I think that's also we need to respond to that. Just to mention to the person that, yes, in existence already, we have this integrated disease surveillance and response training within the health facilities themselves. So it's a way also to bring them on board in the things we do around integrated disease surveillance. So there is, yes, room to see how we can all expand this, but already we have that mechanism in place. And most importantly, we have even the health facility surveillance focal points, and they are all part of, the pool of the trainees when such trainings are being brought to fore. Then I like the idea of somebody brought this to remind us on the internships. Yes, and that was why we capture it as part of what we feel across all sectors we should leverage on. In the short term, this could fill the NCDC. When we have short, this impromptu staff shortage, we leverage on these people because it's not about bringing them only to do our work. They also learn. We build their capacities across. By so doing, we tend to really fill the short-term human resource gap. And I can't overemphasize the importance of communication and advocacy to policymakers. And I'm happy we have our own Dr. Aisha here. That we're already mapping stakeholders for that conversation. So we are happy to do that. And for Dr. Patrick, thank you as always. So we are going to go back to you to fine-tune some of these things. I agree with linking clinical care with the public health work. We've been doing that in response. You could see when we go for research, operational research, we get some of these people from the facilities, from academia. So even for clinical aspect, how do we come together? The emergency medical training that is also being done, how do we further streamline some of these things? So I may not have remembered everything, but it's well taken, and definitely other surveillance. I'm not sure if it's part of this, but exactly those are part of those target audience again for such trainings, because you need them to know and report some of these things when they come, including immigration officers, some of those military, and some of this.
Thank you, ma'am.
Yeah, so thank you, and
Mr. Moderator?
So you would agree with me that the discussions on the workforce is beyond just the pandemic fund application. There's a lot more that we need to do beyond here and now.
Applause for them. Please rise for a group photograph quickly. Ladies and gentlemen, distinguished DG, we thank you for availing us your time today and your very valuable contributions and inputs.
We just cover the validation of the session hub, at least for now. Permit me, DG, to quickly recognize also the Honorable Commissioner for Health, Benwes. Then we also have the representative of the
link. We would like to document some of your feedback apart from the other feedbacks that we've captured across today. We know it's also going to be online. For those that are online, please use the Mentimeter as well. You can use the link or the QR code.
Thank you very much, Chief. So, all right, I think as we tidy up that, no, they are also a professional. I didn't learn this. We have seen at the subnational level, for instance, the challenge with the push component of it. Speak to the fact, subtly trained, you've built their capacity like 4 years. And all of Israel is greatly supporting that with a resolve to save life and other distinguished colleagues. So we're looking at how do we also ensure that when you've built capacity at a certain level, managing the push factor with respect to those subtle political undertones, and how do we also ensure we manage this so that we don't keep repeating the cycle. It's also something that should be in the conversation moving forward. I believe this is important also. All right, it's now left for us to have the closing thoughts from the DG on this conversation. We are happy to have the DG back. DG, if you don't mind, a round of applause for him as he takes us through the closing thoughts on this conversation and the next steps. Over to you, DG, sir.
Let me say, distinguished ladies and gentlemen again. I think you all agree with me that at least we've had a wonderful day. If you have not, I have, because I've learned a lot. And some other interests have come to play here. And I want to remember what the PAMSEC for Kaduna State said. Civil service as PAMSEC, I was very unpopular for a couple of years because I was only fighting everybody. And I didn't understand the civil service. So it was a fight. One thing I remember again that after a while, they got to like what I was doing. So my take is that apart from this application, a lot of lessons have been learned. One is that advocacy is key. We cannot all sit down in our offices in comfort of our profession and expect manners to come from heaven. We have to do advocacy. We have to play the politics. If we leave the politics to the politicians, we will continue to complain every time. So let's start both at the national level and the state level. I also remember that when we started the ambulance service in Lagos, we said we're going to build local capacity. So we decided to train some emergency technicians using the College of Health Technology students. We had the curriculum. We trained the first batch of 50 people. And then we were stuck. Because the problem was that with civil service, the civil service, whatever it is, they had their own rules, they had their own culture that you need to break. So whatever we do again, thinking out of the box, like somebody said, we have to do the advocacy of civil service. And I think the easiest way we can do is through the legislators. They write the laws. Because without the laws, you can't do anything. You can't get appropriation, you can't get function, you can't get anything. This is where we can start from. That's that. But the bit here is for me to, like I said, all the responses we've had have been very, very good. All the contributions from different people. And I think the committee has a lot of work to do within such a short period of time to put these things together and come up with a nice paper. And I think with all your contributions, I think we're good to go. The next bit, actually, a part of the timeline, that when we put these things together, we write a proposal. We still have to present to the 3 ministers for, is it validation or verification or whatever, before we submit. It's a long process. And I think we just have a week to go. So let me say that it's been a wonderful day, at least for me. Apart from this fund, there are many things I've learned. I was taking notes, and my phone is almost dead. So I just want to thank you all for your patience, your time, and contribution. And I think, let me say that your contributions will not be in vain. Thank you very much.
All right, so thank you very much, Director General NCDC, and all distinguished partners. The Secretariat team have done a tremendous job, and they deserve all the applause you can give. So let's make welcome Mrs. Olade, who will be speaking on behalf of the Secretariat team for this great job, one of the directors in the NCDCs. Can we keep it up for her? A better round of applause, please.
Thank you very much. So on behalf of the Pandemic Fund Secretariat, I would like to thank the Honorable Coordinating Minister for Health. Though he's not here, we appreciate his coming and lending the level of support that he has so far to the process, and also being part of the meeting. Representatives of all MDAs, Honorable Commissioners of Health, technical staff of MDAs, development partners, implementing partners, the academia, civil society, presenters, panelists, moderators, the DG, who is the chair of the Pandemic Fund Technical Committee, multi-sectorial secretariat and the writing team, colleagues from the different ministries, colleagues from NCDC. Thank you very much. Thank you for taking time out of your very busy schedules. You've been here since 9 o'clock and spent virtually the entire day here. We appreciate your support to the process. We appreciate your taking time to attend this national dialogue and for participating in the discourse. You're very much appreciated. Going forward, we will be setting up 3 teams. And those teams have been set up before, but we would like to say we want the 3 different ministries to please also still confirm the names that we have. We have a team that will help finalize the proposal, a team that will sit and develop the budget, as well as the M&E team. We will need to start work as quickly as possible so that we can submit the proposal on time. We need to hit the ground running. We may not be able to do so tonight, but we must hit the ground running the entire process and through the entire program. Thank you very much. You're much appreciated. Thank you. And the anchors, I'm very sorry. Thank you very much. Thank you. You're very, very much appreciated. Thank you for supporting the process as well. Thank you very much.
Thank you very much. I saw our honorable commissioners look at the time and they're saying it's a late lunch. It's been an exciting day. So we'll just rise and maybe we'll have the second stanza of the anthem. And then, we use